Let me do that.
Loud and clear.
Okay,
Yes, sir. Yes, sir.
all right. I had to switch computers. My other computer froze up. So it's 1:29. We'll go ahead and open it with duos. Now I'll start to at 1:30. Bismillahir Rahmanir Rahim. Alhamdulillahi Rabbil Alameen. Ar-Rahmanir Rahim. Maliki Yawmiddin. إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. Amen. Welcome to the first Sunday program, and we're going to turn it right over to the Health Consortium and to Imam Mikhail Ramadan.
Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Ashhadu an la ilaha illallah wahdahu la sharika lahu. Ashhadu anna Muhammadan abduhu wa rasuluhu. Sallallahu alayhi wasallam. We always began by thanking Allah for this day of life and opportunity to do better than, inshallah, that we've done in the past. And we thank Mosque Cares and Imam Warth D. Muhammad II for this opportunity as a Muslim Health Consortium to share the information that we've researched and gathered with our community. So with that beginning, we'd like to get right into what we have today. And we are happy to announce today that just the day before yesterday, the World Health Organization declared that the COVID emergency is over, alhamdulillah. And this is after 700 million deaths and 800 million cases worldwide. And it's suspected that the actual number is much higher than that. It's estimated to be higher by 20 million people. And that's because the count was never very accurate in poorer countries. So a lot more people died from COVID than that we've counted. And in the United States, it's been 1.1 million deaths. And the emergency declaration will expire on May the 11th. Today is the 7th, 4 days from now. The emergency declaration, which we've had for a couple of years, will be over. Keep in mind that COVID is not over. It's just less common and less deadly. This past week, 190 deaths occurred in the US. So it's still with us. And we just say, if you feel like wearing your mask, if you're uncomfortable, go ahead and wear it. But this also gives just a pause for looking at what have been the after effects of the COVID pandemic. And we'll just list them. As you know, we've had severe economic and social issues have surfaced as a result of the COVID pandemic. And we know that COVID has caused a great deal of misery and suffering among families and communities during a time that we've suffered with it. And it's been terrible, and we thank Allah that we came through it. And COVID has also highlighted the political fault lines that were just present beneath the surface. And it brought out these fault lines. And we saw the difference in different states and locations of the impact of COVID. And it was basically due to politics. And we also know that COVID also caused a lack of trust between people and their institutions. And we're still suffering with that. And during the time of COVID, we saw the inequalities the inequities, the disparities in health care and resources in real time. And we saw the impact on our community of having the comorbidities that we had, the high blood pressure, the heart trouble, diabetes, and other things, how having something like COVID impacted us worse than anyone else, any other ethnic groups. So we're happy to have COVID for the most part behind us, and we will move on to our next topic. And here. What we will deal with today is what has been known also as a silent epidemic. And this is Alzheimer's dementia. You might have heard it called the old timers disease, but it's very serious. And especially as our population gets older and older, it's having an impact on us baby boomers. In the United States, there are 6 million people with Alzheimer's disease. And worldwide, there's 45.5 million people with Alzheimer's dementia. And among African Americans, Alzheimer's disease is twice as much as other racial groups. But we didn't know that. That's why we say it, a silent epidemic. And the exact reason for that is not clear. Suspected that it's greater risk in the families, genetics, or environment, how they all come together and play a role. What is Alzheimer's dementia? Well, it's a progressive disease that destroys the memory and affects other mental functions. You know, I think of it like somebody got on your computer and start deleting your files. One of your files had all your family pictures in it. Delete. Another file had all of your memories in it. Delete. Another file had to do with your ability to reason. Delete. And that's what Alzheimer does to us as individuals. And brain cells and their connections degenerate. And when they do, the important connections that they were making, which is our memory, our thinking, our thoughts, our personality, also deteriorate. So Alzheimer's dementia represents about 60 to 70% of the most common types of dementia. And in the past, Alzheimer's was diagnosed only after death. You had to take a biopsy of the brain and look at it under a microscope and look for these amyloid deposits, or and that's how we said, oh, that person has had Alzheimer's. But today, we're now able to diagnose Alzheimer's with a great deal of certainty. And this is by using the newer techniques that we'll mention. But we want to keep in mind that Alzheimer's is only one form of dementia. There's other forms of dementia, FTD, frontotemporal dementia, low pressure hydrocephalus, strokes. There's Lewy body dementia, Parkinsonism, and cognitive mental decline. We won't go into all of those because they are whole subjects and discussion in and of themselves. The things which increase one's risk for Alzheimer's disease is smoking. We hope no one's doing that. Diabetes, depression, and genetics. These are the things that we should look for. The 10 early signs and symptoms of Alzheimer's disease. Memory loss that disrupts your daily life. Number 2, challenges in planning and solving problems. Okay. 3, difficulty in completing familiar tasks. Okay, these are tasks that you do all of the time, and suddenly they become difficult. Confusion with time and space. What day is it? What month is it? I don't know. Trouble understanding visual images or spatial relationships. Okay, I didn't know that car was that close on me. Oh, is the clock upside down? These sort of things. New problems with words and speaking or writing. Misplacing things and losing the ability to retrace your steps. Don't take that one too seriously. All of us misplace things and we're forced to have to think back on now, what was I doing? How did I get here? Where might I have left it? But when it becomes serious, decrease or poor judgment, okay? Withdrawal from work or social activities, okay? Becoming a recluse. Change in mood and personality. And psychological depression, getting paranoid. Coming at the television is talking to me. Hallucinations. Problems with memory, language, thinking skills, reasoning, mental function, or suddenly begin wandering and getting lost. Any of these things that stand out are concerns. Now, how do we approach a suspected Alzheimer's patient? And basically, it's essentially what we do with each patient. We get a history, a full history, physical exam, we get a neurological exam, we get a mental status exam, we get diagnostic lab tests, and we get brain imaging. This is essentially the workup. We want to find out questions like, what kind of memory trouble have you been having? Memory lapses? When did they first start? How long have you been had them? And are they getting worse? You need to know that. Have you stopped doing certain activities? Just cut them out because they became more difficult or you couldn't remember how to do it. Such things as your finances or shopping. These activities became too mentally challenging. Okay? How's your mood been? More depressed, sadder, anxious than usual? Want to hear changes or a downward progression is what we're looking for. Gotten lost lately while driving? Forget the way home? Turn down the wrong street? These are things. Have other people express problems with your driving that you may not have noticed? So it's important that we look at one another and ourselves to see if we have any of these signs or symptoms. How has your energy level been? What medicines are you taking? What vitamin supplements are you taking? And especially if you are drinking alcohol, that can be an issue for those that drink. Have you noticed any trembling or tremors or difficulty walking? Any trouble remembering things? How's been your hearing and your vision? Has anybody in your family had memory trouble? Anybody been diagnosed with Alzheimer's disease or dementia? This is important for us to know. And one thing. Do you act out your dreams while sleeping? Do you punch or flail or shout or scream? Because you think you're fighting in your dream. Okay. That's one. Someone again has to tell you. Now, we mentioned the physical exam. It's a standard physical exam, and we look for signs in doing that. But the neurologic exam for working up Alzheimer's is very important. How are the individual's reflexes, muscle tone and strength? How is this ability to get up from a chair and walk across the room? There's a lot that you can see in the gait of a person. And how is his sight and hearing, coordination and balance? Those are the things that you look at in the neurologic exam. And then we order tests, mental status and neuropsychological testing. Right. You can test your mental status. This gives us a lot of information. How is the person's thinking skills, problem solving, memory, short-term, long-term? How is his orientation, time, place, and person? These are issues that need to be looked at. And then blood tests are ordered that can help us rule out other potential causes for memory loss and confusion. As we said, there are other causes for dementia. Thyroid disorders, vitamin deficiencies, these have to be looked at. But the important ones for Alzheimer's are the biomarkers. They can detect the presence of plaques and tangles. Right, we haven't mentioned plaques and tangles. Those plaques were the amyloid plaques that the early workers on Alzheimer's did when they did a post-mortem brain biopsy. They were looking for these amyloid plaques in the brain. But now we can do certain scans that will show us these plaques. PET scans, they show us the plaques and they show us the tangles. And we do blood tests that show evidence of the amyloid in the blood or in the cerebrospinal fluid. That's helps make the diagnosis. And just a quick, we're watching our time. We have our other presenters. In the neuron has dendrites and axons, and these are the long arm-like portions of the nerve cell that connects to the other nerves. And this is the channel through which the communications occur. And when the communications is occurring, a whole network is set up, just like on your telephone poles and lines. When they're up and functioning, you get the electricity. Same thing with the nerves and the brain cells. When they're up and functioning, your memory is fine, your reasoning is fine, all of these are fine. But when they deteriorate or break down, the wires get tangled, like we said, tangles, it gets messed up, and you begin to lose memory. And after they've been down so long or interrupted so long, they die. And then you get brain shrinkage. And for some reason, this seems to happen, particularly in the area of memory in our brain. So we can look for that with the scans, with the MRI scans, the CT scans, and the PET scans. And also these scans are looking for other causes for dementia. such as stroke, trauma, or tumors that can mimic these forms of dementia. So we want to keep moving quickly here. Now, what are the medications? Basically, the sorts of medications that that we have are two main types.
Excuse me, one moment. Dr. Ramadan?
Yes.
I'm just checking to make sure that you can hear me. I know the Mosque Cares, you don't see our video up. Our technical, Imam Adil, he's running a little late. He got caught in traffic. And I just want to let you know I'm here. I've been here. I've never been late to a first Sunday meeting. Or matter of fact, I can't remember anything I've ever been late to. So I'm here. I just want to greet everyone and welcome you all to the Mosque Cares First Sunday. And hope all is well. I see Imam Elam and I send a greetings to him also. Okay, you can continue. I'm Wadafuddin Muhammad, Imam Wadafuddin Muhammad.
All right, very good. So thank you. No problem.
Yeah, okay.
Okay. As we said, there's two main types of drugs that we use to treat this. And the acetylcholine is the neurotransmitter and a drug that will help acetylcholine in the brain is what we call cholinesterase inhibitors. So if you want more acetylcholine, then you inhibit the things that break down acetylcholine. And that's what this class of drugs does. It stops the things that break down the acetylcholine and leaves the acetylcholine present so it can help make the nerve-to-nerve communications. So that's one form. And the other is Namenda. And it does it through another pathway, but it also helps the slowing up the deterioration of mental status and mental function. And there's a lot of a number of medications, proprietary medications under each of these classes of medicines. Aricept, Exelon, patches that you can put on. And some of them are very good early on with early Alzheimer's or early dementia, but their effectiveness wanes as the stages advance. Fortunately, we have a new medicine, a couple new classes of medicine that have been developed, and this is Aldahelm, and it leverages the immune system. It uses, and you've heard this before, monoclonal antibodies. Right. It uses this to help attack those amyloid plaques that develop in the brain that disrupts the communications between nerve cells. So this is a fantastic advancement. It's being tested now, and it is fairly good in mild cognitive impairment in Alzheimer's. And also it has another one out in a similar group. It's lecanemab, and it is reported to show or to slow Alzheimer progression by 27%. This is fantastic. The problem is the cost of these medicines. I've seen in some papers from $35,000 to $85,000 a year. It's IV once a month, and that's just prohibitive for most people. So it's still being worked on, and it's just too important to be restricted due to costs. Finally, you may ask, what about alternative medicine? Does it have a role? Can I take natural medicine or herbal medicine or anything to work on these on Alzheimer's or dementia? Well, let me say that there's been little evidence that they're effective as treatments. Now, that's not saying the whole story. Things like vitamin E may help delay symptoms getting worse in people who already have mild to moderate disease. Okay? And omega-3 fatty acids, okay? Important. These supplements may lower the risk of developing dementia. But remember what I said, are useful in treatment of dementia. And for the studies that have been done so far, we don't see that. Also, curcumin. This is very good. Turmeric, anti-inflammatory. And black seed, absolutely. I take that, and a couple of these I take. And ginkgo hasn't been shown to be effective in the treatment of it, but historically, it's been used, and melatonin for sleep. So with that, we've gone just a bit over our time here. I want to turn it over into the hands of my colleague, who will highlight some of these areas and take us further into it. So thank you, Sister Sharon.
Yes, sir. Assalamu alaikum.
Walaikum assalam.
Thank you so much, Dr. Ramadan, to Imam W.D. Muhammad, President, the second of Mosque Cares, the listening and viewing audience. It's a pleasure, once again, a blessing to be before you. And what we have is to add what Dr. Ramadan has explained to you, a visual aid. And so, inshallah, we're going to go through a PowerPoint. Imam Elan, if I can have the capacity to share the screen. Is that...
Sister Sharon, you already have it, but I got you. We'll share it for you.
Alhamdulillah. Thank you, Imam Elan. All right.
Thank you.
And as we're waiting for the PowerPoint, it's up now. If I could, just see a show of hands of you in the audience who have basically known someone in your family, a friend or acquaintance that has been through some type of memory disease, one of the dementias or Alzheimer's. I'm sure most of our hands would go up. And so we're just going to review some of the aspects of Alzheimer's disease as one of the dementias, inshallah. So on the first slide, actually, you just see basically the components of the brain, the parts of the human brain. And basically when it is healthy, that's what you would see. Next slide. Alhamdulillah. So this is almost my favorite slide. This is stimulating to the brain and the mind. What this is a field of beautiful purple lavender flowers. Their fragrance is excellent. And this is actually on a walk path not far from where I live. And basically, this is what you want to do. Inshallah, you want to stimulate your brain in order to keep your brain healthy, as well as your heart and your body and your mental health optimal as you age. Thank you, Brother Adil. Next slide, please. So Dr. Ramadan has already discussed what Alzheimer's is and the fact that it's one of the common forms of dementia. And basically, I just wanted to call your attention to, it's not the natural part of aging. It's not natural. And so the majority of the people, as he said, are over 65. And it can be early onset, if the person is under 65 years of age. So what I want to do is show you a brief video of what Alzheimer's disease actually is. Brother Adil, can we bring up the Alzheimer's video? On your side, or should I?
Sister Sharon, you said the video?
Yes, sir, the link,
Yes, ma'am.
thank you.
What is Alzheimer's disease? Alzheimer's is a slow, fatal disease of the brain affecting 1 in 10 people over the age of 65. No one is immune. The disease comes on gradually as 2 abnormal protein fragments called plaques and tangles accumulate in the brain and kill brain cells. They start here in the hippocampus, the part of the brain where memories are first formed. Over many years' time, the plaques and tangles slowly destroy the hippocampus, and it becomes harder and harder to form new memories. Simple recollections from a few hours or days ago that the rest of us might take for granted are just not there. After that, more plaques and tangles spread into different regions of the brain, killing cells and compromising function wherever they go. This spreading around is what causes the different stages of Alzheimer's. From the hippocampus, the disease spreads here to the region of the brain.
The video has stopped.
We started right back.
And so why Brother Adil is bringing back up the Alzheimer's video, so we want to realize that as the this condition progresses, Dr. Ramadan explained to you the different symptoms. But when is it time for the patient to go, the person to go in to get skilled care? That's very important. And what we need to do is, as Dr. Ramadan was saying, just to monitor, what's going on. Are they able to actually participate in their activities of daily living? And if not, what do we do? What's next? So I encourage you that don't have a long-term care policy and you're still working, you might want to think about purchasing one, because you freeze in the cost of it and you're going to be paying for care for someone in your home or in a skilled nursing facility. You have the insurances, Medicare, Medicaid, and it also varies within your state as to what will be covered. You have the VA for your veterans out there. So basically you need to know your resources. As far as your memory, at 65 years of age right now, the standard is, it just happened to me, the standard is that your primary physician will give you a memory screening, basic memory screening. If you pass it, fine. If not, then she will actually put you in touch with a neurologist, and you will go from there as far as what interventions you need at that time.
To solve problems, grasp concepts, and make plans. Next, the plaques and tangles invade the part of the brain where emotions are regulated. When this happens, the patient gradually loses control over moods and feelings. After that, the disease moves to where the brain makes sense of things it sees, hears, and smells. In this stage, Alzheimer's wreaks havoc on a person's senses and can spark hallucinations. Eventually, the plaques and tangles erase a person's oldest and most precious memories, which are stored here in the back of the brain. Near the end, the disease compromises a person's balance and coordination. And in the very last stage, it destroys the part of the brain that regulates breathing and the heart. The progression from mild forgetting to death is slow and steady, and takes place over an average of 8 to 10 years. It is relentless and, for now, incurable. Helping your family, friends, and neighbors to better understand Alzheimer's will reduce stigma, improve care, and even help the fight for a cure. Thanks for helping to do your part. Learn more at www.aboutalz.org.
Alhamdulillah. Excellent. So basically, we've learned what Alzheimer's disease is. We know it's one of the dementias, one of the major dementias. And so we want to advance to the next slide, please, Brother Adil. Alhamdulillah. Dr. Ramadan spoke about how Alzheimer's is diagnosed, and actually, initially, we could not diagnose until the person was dead, and they examined brain tissue. He explained that to you. And then they saw the plaques and the tangles that you also saw if you're on video, just what occurs. And so now we are moving into a much, much more efficient technology to really pinpoint where this Alzheimer's disease is coming from. And he also spoke about the fact that Alzheimer's is one of the most common dementias. And then among the other ones, you have vascular dementia and dementia with Lewy bodies. I also to mention Parkinson's is under one of those dementias as well. You have some famous people. Our dear brother Muhammad Ali suffered from Parkinson's disease. And if you know of actor Michael J. Fox, he suffers from Parkinson's. Or just a name that's another form of dementia. Thank you, Imam Elan. So we're just going to talk quickly, and actually this is a review. We know advancing age can put you at a risk for Alzheimer's, your family history, your genetics, heredity, and these head injuries. We know these contact sports, traumatic brain injuries for war, the soldiers, boxing, things of that nature. We know there's the head-heart connection. So if you're not taking care of your heart, you have cardiovascular disease and things of that nature, you're also doing damage to your brain. Next slide, please, Brother Dale. Alhamdulillah. Just to review, these are just 5 foods. You want to get those green leafy vegetables in, the fatty fish with the omega-3, the berries with their beautiful colors and hues. You want to make sure you also get your tea and coffee in, but if you have hypertension or high blood pressure, so you want to modify that, but it does increase your memory. Walnuts are a good source also of omega-3 fatty acids, and so you definitely want to make sure you get your walnuts in. So one fact is that there's no single food that's entirely responsible for promoting your brain health. So one important strategy is to maintain an array of, your diet rich in green leafy vegetables, your fruits, your legumes, and your whole grains. And also that physical activity, managing your stress, and seeing your doctor regularly if you see any different changes in your memory. Next slide, please, sir. Thank you. Dr. Ramadan already reviewed the various medications that are on the market at this time. And we also just want to reiterate that basically, if you know someone who has Alzheimer's and there's different changes that are going on with them, some of the things that could happen is basically, did you move them out of their normal space? Did you change their caregiver? So some of those things before you put medications in their bodies, just think about some of those things that you can correct prior to the medications. Thank you. Next slide. Excellent. So again, just to review, these are some things you can fix, brothers and sisters out there. These risk factors. You have to get up and move. We got to get that aerobic physical activity in at least 3 times a week, inshallah. If you're smoking cessation, we talked about that earlier. No drinking, no, they have excessive alcohol use on this page. Obesity, of course, being overweight, hypertension or high blood pressure, diabetes, being depressed, and even hearing loss. So don't just accept hearing loss as being part of who you are as you age. Get it checked out, get the proper treatment, because it can add to you developing Alzheimer's. Next slide, please. Thank you. Okay, just reviewing the risk factors in the family. We talked about the genetics of it all. And basically, there's a particular gene that you're looking for. And if you have it, it does increase your risk. But again, you have the mitigating factors. That doesn't necessarily mean that you are going to develop Alzheimer's. We talked about the traumatic brain injuries and head injuries. Everyone in the car should be buckled up with a seatbelt. If you're riding a bike, playing a contact sport, you should have a helmet on. And that we know that heart health is related to brain health. Thank you, Brother Adil. Next slide. I love this slide, the color of it all. But basically, the first part of this slide, if you can't see it, it's a picture of a human brain, a healthy brain. And it says, mind your mind. And it's from Brain Injury Awareness Month. And actually, just to put in that this is also May is Mental Health Month, Awareness Month. So just remember that fact. We also have these colorful foods of the rainbow, the fruits and the vegetables. We also have our raisins and our legumes and nuts. And so very good. Alhamdulillah. Next slide, please, Brother Dill. All right, let's talk about African Americans. Oh, genetics. Just a review, basically, just because grandmother or grandfather, your mother, your father, your sister, you, your brother, your family members, again, you do not have to necessarily be doomed, not doomed, but you do not necessarily have to be diagnosed with Alzheimer's later in life. Next slide, please. Thank you. Let's talk about the Black Americans and Alzheimer's disease. According to the Alzheimer's Association, among Black Americans who are ages 70 and older, 21.3% are living with Alzheimer's. Some quick facts that while Black Americans are twice as likely as older whites to have Alzheimer's or another dementia, research hasn't yet identified the cause. The higher rates of cardiovascular, heart and blood vessel diseases may play the role. Now, some studies indicate that after correction for the overall health and socio-economic status, these differences appear. So earlier in some of our presentations, we talked about the social determinants of health. And here it arises again, is basically, if we're all on an equal playing field, then the differences disappear. Only 20% of Black Americans say that they have no barriers to excellent health care and support for Alzheimer's or other dementias. Next slide, please, sir. Thank you. Half of Black Americans say that they have experienced discrimination while seeking care for a person living with Alzheimer's. Only 48% of Black Americans report being confident that they can assess culturally competent care. That was actually the theme of April, getting culturally competent care. Does this person who's taking care of you know your background, being there themselves, basically, and access to care? So culturally competent care so that they can be your champion and as well as yourself. Only 53% of Black Americans believe that a cure for Alzheimer's will be distributed fairly without regard to race, color, or ethnicity. Only 35% of Black Americans say that they are concerned about Alzheimer's or dementia. 65% of Black Americans say that they know somebody. That's over half of us, know somebody with Alzheimer's or dementia. 55% of Black Americans think that the significant loss of our cognitive abilities or memory is natural, but somehow we can stave off that particular condition, Alzheimer's. And so next slide, let's see here. Yes, what do we think about clinical trials? So of course we know our history about clinical trials, the discrimination, namely the infamous Tuskegee syphilis study, and that has contributed to high levels of mistrust among us. So near 2/3 of Black Americans, 62%, believe that medical research is biased against people of color. The most common reasons Black Americans do not want to participate in clinical trials are, we don't want to feel like guinea pigs, which 69% of African Americans name as a concern. Now, Black Americans are also far more likely than other racial groups to be concerned about getting sick from treatment, with 45% describing this as the reason. So we have just a small YouTube video about the New Ideas clinical trial. So that features our African American brothers and sisters, as well as the Hispanic brothers and sisters. So Brother Adele, can we share that slide, please?
Hello, I'm Maria Carrillo, Chief Science Officer at the Alzheimer's Association.
And I'm Carl V. Hill, Chief Diversity, Equity, and Inclusion Officer at the Alzheimer's Association.
Dr. Hill and I want to tell you more about Alzheimer's disease and how the Alzheimer's Association is working to end Alzheimer's and all other dementia. Alzheimer's affects more than 6 million people in the U.S. alone, and more than 11 million caregivers. As someone who has seen the impact of Alzheimer's in my own family, I know Alzheimer's impacts every aspect of our lives.
As Dr. Carrillo mentioned, Alzheimer's is a huge problem, especially in Black and Hispanic communities. We recognize health disparities and systemic inequities have occurred for far too long, which have led to a lack of trust in our communities. And Alzheimer's disease is no stranger to these problems.
There's a lot of work to be done to address these problems. And Dr. Hill and I know that research is the first step to learn more about how Alzheimer's impacts all communities and all people. Research is hope for all of us. We need you to help us end Alzheimer's for your community and future generations. One way to help is to participate in clinical trials. One study is New Ideas, led in part by the Alzheimer's Association. New Ideas uses brain scans to explore what happens in the brain to cause memory loss, and the results of the scan may help your doctor provide better care.
By participating in studies, we not only learn more about Alzheimer's and dementia, but you will help our communities learn more about how these diseases specifically impact Hispanic and Black communities.
It will be thanks to you that we make this and other studies successful and ensure that treatments are appropriate for all of our communities, not just a few. With your help, we can learn more about Alzheimer's. We can get treatments faster, and you can help your community and your family's future and help us all create a world without Alzheimer's and all other dementia for future generations.
To learn more, go to alz.org/new-ideas or ideas-study.org, or visit TrialMatch to see where there is a clinical trial near you.
Very good. Next slide, please.
Hello, and welcome.
So we're not going to read, Dr. Ramadan went through the various stages. There's a first stage, and he talked about just how we are losing our short-term memory, expressive language changes, receptive, behavioral changes, personality changes, being depressed. And basically it's very important when we talk about depression, that basically we stay social. So if we're living alone, is someone speaking? If we're living alone, that is a risk factor, actually, for becoming depressed. So we definitely want to make sure that we stay social so that we won't actually succumb to being depressed. Next slide, please, sir. Thank you. Okay, this is the middle stage, just everything worsening, long-term, and we have in the middle, we still have a long-term. We can remember our parents and, things of that nature back in our memory, but the short-term, more and more, Dr. Ramadan talked about it, forgetting your way home and things of that nature, and somebody telling you, oh, you're not driving the way you used to drive, or you just missed that car, things of that nature. And this disorientation and poor judgment. And then later on, onset of seizures, urinary and bowel incontinence. Swallowing, as a former respiratory therapist, that is very dangerous because you will find that if you're not swallowing correctly, you can aspirate, and basically that will go into your lungs instead of your stomach, or your down your esophagus into your stomach. And that's very dangerous. We talked about mobility changes, difficulty in walking, and poor depth perception. The next slide, please, sir. And the final stages. And also, as we talk or review the final stages, when everything, you become dependent. Just as you came into the world, you're totally dependent. You're in the bed or you need a wheelchair. Very little speech, body mechanics. And again, we talked about the aspiration pneumonias and full inability to control your urine or your bowels. Now, I also want to say on this last slide, before the person reaches this particular stage, an advanced directive should have been. So you think about that as you go through these stages. What are our advanced directive? What do we want for ourselves if we reach a stage of this type of illness? So that's very important. That's a family talk. And next slide, please, sir. Thank you. Alhamdulillah. Just reviewing, we don't have to review the types of dementias, but it is a general return for memory loss and other mental abilities, and severe enough to affect our daily activities of daily living. And the next three slides are actually, before we go to the references, we want to make sure you get an evaluation. We talked about that. Repetition is key with this. Don't let things that you notice that aren't the norm for you stay without getting checked out by your general practitioner. That's, if you're concerned about your memory, ask for a memory screening if you have not received one, and then they can, if need be, connect you with a geriatric neurologist to determine if you require further treatment for memory loss. This is key. Make a list of questions. Ask your healthcare provider. Ask your healthcare provider these questions and take notes. And this is also key. If you are concerned about your memory, have a family member or friend accompany you to your appointment to help you remember the discussion. Next slide, please. Thank you, thank you. This is one of my favorite slides as I opened up. Which one of us have not been a caregiver? And so you're not alone. You basically, there are resources for respite. And respite, according to the Alzheimer's Foundation, is when you get rest and relief. You get a break from being a caregiver to take care of yourself. So we talked about earlier, there is home care. You can have home care, skilled home care for your loved one with Alzheimer's. These are medical professionals. They'll take care of the personal care of the person and also some housekeeping needs. There are adult daycare programs. We've tried this with a loved one. Basically, you have the ability for your loved one to socialize in a safe environment. And this is also covered by your insurances. You may have to go out of pocket some costs as well. Facility-based respite, okay, they stay there away from home, and this gives you respite. And then it's time to have a family meeting, in person or virtually. Who in your family is capable and able to assist you with your loved one? And then you have the friends if it's early onset, they can have friends who want to come in and assist you while you get respite. Or if you yourself have a circle of friends, basically you have friends who can also assist with respite. And now to the very last slide, Brother Adele. Thank you. All right. So Hadith 19, I love this. And basically, this is Hadith 19 of the 40 Hadith, and it says, be mindful of Allah. You will find him before you. Get to know Allah in prosperity, and he will know you in adversity. Know that what has passed you by was not going to befall you, and that what has befallen you was not going to pass you by. And know that victory comes with patience, relief with affliction, and ease with hardship. So on that note, Assalamu alaikum, and we can open the floor, inshallah, to questions. Dr. Ramadan.
Alhamdulillah. That was a very wonderful presentation. I enjoyed that, especially the hadith at the end too. So was there any questions that the audience would like to ask that we might be able to help with now?
Okay, right. Please raise your hand in the audience. We're acknowledged by the order of the hands that were raised. And we'll start with Sister Ellen Rahman.
Assalamu alaikum.
Walaikum assalam.
Dr. Ramadan and Sister Sharon, thank you for a presentation this afternoon on Alzheimer's. You went into my career path. I was a assistant nurse manager and nurse manager for Alzheimer's, dementia. Some days you don't come out whole when you're dealing in that environment. And we went from the various, everyone is not impacted the same as you presented. I was around when Aricept and Dementia came out, and we were able to see results. When they were given in tandem, we were able to see results with the Aricept and the Dementia. With a musician had stopped playing, but once we onboarded Aricept and Dementia, he was able to pick his instrument, which was a guitar. He was able to pick that back up and start playing. We had incidences, as you stated, of the behavioral issues. And this where it became interesting for us, because we had an executive that owned his own company, and his wife, petite, beautiful little woman, but how it impacted him to our female staff. He began to grope our female staff. He began to call them horrible names. And so we brought a psychiatrist in, and she did the study between him and his wife and would ask the wife questions. And she, as you stated on your slide, Sister Sharon, how it grows. And that's what she came and informed us. And where it grows to is what you'll see impacted. And from there, we begin to know how to do different things. We will point out to where we're having other behavioral issues. And Allah forgive me, but one of our residents, she would just challenge other residents. And I eventually had to have that resident removed from the nursing home long-term care facility that I was in. It was the Rolls Royce of long-term care facilities. And the daughter was so angry with me, but I could not have that resident causing other behavioral issues with other residents. It was just not, it wasn't feasible, and she had to go. And Allah forgive me for that, because it was about making sure that we can maintain peace in that environment. Also, Dr. Ramadan, you talked about the spatial view. We had a resident, her eye depth perception was so off that she couldn't go from carpet to the bathroom for her bath day because it was a white tile floor. And she would begin to raise her legs up like she was stepping. And so in order to get her bathed, someone had to get in front of her so that she couldn't see that floor. And that was the only way we were able to get her bathed. And Sharon, you talk about the long-term care insurance. I didn't know about it back then, but I would get a call monthly for one of the residents whereby the insurer was calling to see how she was. Now, as an insurance agent, I know about long-term care insurance and can offer that. So again, alhamdulillah, and thank you for such a well thought out presentation. Assalamu alaikum.
Walaikum assalam. Thank you, sister, for your comments. And I just to echo the impact that that drug combo of a cholinesterase inhibitor, the Aricept or Exelon, and the Namenda has for individuals of mild to moderate can make a significant difference. And sometimes the doctors start them individually, and then as things worsen, then they give them together. But it does work very well oftentimes, but not in the advanced stages. And you do highlight that any sort of combination of personality change can happen with people. And you know, they could be mild and wonderful and friendly, and they can become like raving individuals that you wouldn't recognize. And they can go to not recognizing family members or
That's
being
correct.
hostile with family members.
Mhm.
And all of these things can happen.
Right.
So you have to be aware that they are suffering with a disease, because you can't approach them the way they come,
Right.
because they are having difficulty. And you
Right.
always have to keep that foremost in mind, because you will see strange combinations of personality, paranoia, hallucinations,
Yes.
you know, childhood, adolescent behavior,
Yes.
over-sexualized behaviors.
Yes.
These things can occur.
Yes.
So, you know, you worked in that unit. So, alhamdulillah, thank you. Did you have anything to add, Sister Sharon?
No, sir. Alhamdulillah. Thank you for that, Sister Ellen, sharing real time, you know, as that type of caregiver in that type of facility.
Alhamdulillah. Honor and a privilege.
Next question.
All right, up next we have iPhone. Person with the iPhone and their hand raised.
Somebody can go in front of me.
Assalamualaikum, that would be me.
No, I think that was
Oh,
just Sister Chahida, but she said you can go in front of her. So go ahead, Sister Haja. Then we'll go to Dr. Agent, and we'll
Okay.
come back to Sister Chahida when you're ready.
Alhamdulillah, alhamdulillah. You know, I just lost my sister-in-law to Alzheimer's, I think April 1st. And she was at home for a minute, and they tried to keep her at home, which we were trying to do. But for some reason, she got violent one day, and she just got a knife, and she was getting ready to cut some of everybody. So they had to find a home for her quick, fast, and in a hurry, because she was even threatening her mom. And it was just ugly. So that Alzheimer's is something. But where did it come from? Because it looks like in the last 20 years, it's just popping up. And I don't understand it, but it's scary. You know, I mean, you have some that can be nice, And then you have others who just violent. They get violent. They weren't violent before, but they violent now.
Right.
You know, I also had a friend who had her father. She would go and her father got the disease, and then she would go to the hospital to see him, and he would curse her out and run her out the room. And then when the wife would come, he would say there was a woman in here, and he was talking normal. You know, there was a woman in here, and I had to run her out of here. And then the mother said, "That was your daughter. That was your daughter. That was your daughter." And he said, "No, it wasn't." So he'd go back and forth. So it's really sneaky, and it's also dangerous, and it's scary for family members. And may Allah make it easy for us all. I thank you for listening to me. You know what I mean?
You know, sister, you say, where's it coming from? We're all getting older. The baby boomers is a large cohort that's passing through our population. All of us, we were and have carried a great deal of weight when we were all together as adolescents and then the young adults, and now we're all senior citizens and getting elderly at the same time. So what we carry with us impacts the society because the weight of our numbers. So it looks like it's a lot more, but it's just a lot more of us with the problem. So, you know, when you mentioned those cases, I remember when I was in training, we rotated through nursing homes, and we had this one well-known pastor. Oh, he was on the radio and everything, and he was up there. It was and he was, you know, because of what he was suffering with, he became so foul-mouthed. He was. You wouldn't believe that he was a pastor in the past, you know. And everyone had to be protective of him and his reputation and all, because he was suffering. But you would not have guessed that this was him before the onset of this illness. So, you know, we have to. It really calls on those caregivers to extend yourself and to have deeper understanding of what's going on. Okay. Next question.
Okay. Assalamu alaikum, Brother Dr. Ramadan and Sister Saran. And also assalamu alaikum to Imam Warqi Muhammad II and Brother Adil. I just wanted to my mother passed 2 years ago as a result of Alzheimer's, and I had taken care of her for 10 years and saw the decline from now to all the stages that you spoke on today. It was a wonderful presentation. Appreciate all that you do and the information. What I wanted to offer, one question kind of got answered with Sister Lala, and that was seeing an increase seemingly in our community. I did work with that particular association, the Alzheimer's Association here. I had my mother involved with it to try to be, you know, some of the things that she was going through to report it so that they could document a lot of the things that are going on, which I definitely advise as many of us as possible to become a part of these kind of research information, because it really does help. The other thing is my being happy that you presented the information is because we, the persons taking care of those who have this experience, need to be fully knowledgeable and equipped. Because in my case, I had to help the physician who was the physician of my mother once she got into hospice care. I saw her every day. So I knew things they really did not know. And there was a point where he told me to stop feeding her. But I knew that the body was not saying, I don't want food. So I found ways in which to feed her. And where they had said that she was going to pass in 2 weeks, processes that I came up with helped her to live 2 more years. So I'm saying to those of us who may end up with this experience with a loved one, that we educate ourselves, that we know, that we trust our own intuitive insight, but trust it based on your knowledge of the medical situation, biological situations, and we can be informed about these things. And then secondly, that you get all of the legal, medical authority over that person, because that was another thing that helped me out so much, is because I could say, no, I don't think this is going to work. So therefore, I don't want you to do that with my mom, you know, and that helped a lot because they couldn't come in and just take over the situation with my mom, and just do more legal things, be more informed, so that we can have the best care and we can be the best advocates for our loved ones. And her neurologist helped in terms of telling me it was no need in me worrying about whether or not I would end up with Alzheimer's, to just be aware of, you know, the things, symptoms and things that you indicated, but that if you started trying to worry yourself over it, she did have 2 other sisters that passed as a result of it. But we don't want to begin to just think it's inevitable that we will end up, you know, having this as our life experiences. So thank you again for the information, and this helps all of us a lot as being informed, and we really, really want to be informed about things. Thank you. Assalamu alaikum.
Wa alaikum assalam. Yes.
Next, Imam, Sister Tahida, if you're ready, you can go ahead. If not, we'll go to Imam David Ziad. Go ahead, Imam David.
Assalamu alaikum.
Wa alaikum assalam.
Greetings to everybody. Excuse my camera. I just want to participate in the conversation and make 2 short comments. One of them, some of the research for Alzheimer's and dementia showed aluminum deposits on the brain was a common factor, believed to probably come from the use of aluminum, but also from deodorants, aluminum oxide and other things that have been used. That might be a common factor for us to have some discussion on. And the second thing, to increase brain memory, there's associations that dental flossing regularly stimulates the gums, and that same area of the brain is where memory and things like that. That's all I have to say. Thank you everyone for the program. Assalamu
alaikum. Yes, aluminum has been a point of focus for some time. Aluminum cookware, aluminum deodorant, and you know, its role. I can't really speak to any. No studies come to mind at the moment, but I've been aware of it. That it's been alleged to play some role. So thank you for bringing that up. And what was the other? You made one other point too.
Dental flossing.
Oh yes, dental flossing. Yes, thank you. That's the first time I heard that. But alhamdulillah, thank you for that contribution.
Assalamu alaikum.
Wa alaikum assalam.
And they have aluminum in deodorant.
Yes, that's what we mentioned. We mentioned that. I mentioned indeed. That's why they always in some commercials you hear them say there's no aluminum, because they're alluding to aluminum and its role.
Is that what caused a lot of breast cancer?
I don't know about aluminum and breast cancer.
It's close, very close to the body.
Yeah. So we did have, Brother Sharif, if you want to raise your hand, we'll come back to you. But we do have Sister Dr. Rashida Muhammad, who's up next for the question.
Assalamu alaikum.
Alaikum assalam.
Yes, sir. I appreciate your presentation. And I think it's a lot of aspects to deal with. And, you know, you covered a lot of aspects. I like what Dr. Adrian said. My mom, she had Alzheimer's, and Allah blessed me to have her with me until she passed. And we went to the hospital. And what the hospital did, they fed her in a different way that I fed her in. Because, you know, like Dr. Adrian said, when you know the patterns that work, you know, that's what you do. And somehow when they were feeding her, it got into her lungs. But I just want to say, I pray, inshallah, that we can do research in our community and, you know, do our trials in our community. You know, inshallah, that can begin where people can have more trust and faith in what we're doing, and that we have their best interests in, you know, not our own. Because I might have missed the first part of what I might have said, what causes Alzheimer's. I heard someone say something about aluminum, and I like to do research on all different aspects. You know, I don't think one person can be responsible for all the aspects that you can deal with in a situation. So I was told something that, you know, around my house, there's a lot of helicopters, right? And you know, then some of the people told me that they spray down aluminum and lead because they take, sometimes they do some picture taking or something like that, where they have to have certain chemicals in the air for that to take place to be able to see a person, the heat that shows the person's body, you know. Because I was told I had a lot of lead and aluminum, you know, in my system. And I was wondering what that was, you know, maybe coming up, or, you know, something just like using copper pipes when they did tap water. But I was told that what they do is spray down some, like I said, aluminum and lead, so the picture will take place. It's not a picture, you know, it's a picture like they can just see the heat coming from your body, and they can see you moving. So a lot of that is done sometimes. And I wanted to ask you, Dr. Ramadan, you know, you spoke on a lot of things. What are other chemicals that could possibly cause the Alzheimer's? Because dealing with some of the young people that I deal with, that I know that a lot of them go to the cannabis places. And, you know, coming up, some of the people I knew back in college, they would smoke weed, but they would they would grow it themselves, you know, things like that. And I know that a lot of stuff was laced too nowadays. And sometimes back there with formaldehyde, and now things are laced with who knows what. You know, some of the, what they call them, the dispensaries, we don't even know. We don't even know if a population is targeted, if a population is done an experiment on, or what. And like someone said also about chemicals that are in food, Brother Zaid, and, you know, someone else. But I'm saying, I have some young people around me, like in the early 20s, they act like they elderly people. You know, sometimes people think just because you're old, you don't remember, but Allah does say, you'll live a certain time, but not knowing much after you knew a lot. But they forget their keys. I mean, on a routine thing. Every time. Have you seen my keys? I don't know where I put them. I say, they're right there. I say, are you smoking that weed? Yeah, but Grandma, what that got to do with? I'm thinking that research can be done that we could do, that, you know, to even bring out things that actually cause people, you know, for this to happen, you know, like the chemicals and like different things that we don't even think would. I think that would be good. And I just pray, inshallah, that we can, you know, start our for the benefit of all people.
Yes, ma'am. Let me to comment on that, the show a connection. We gave our talk last last night to Lifeline, and it was on Parkinson's disease, which, as you know from the presentation we just gave, that Parkinson is one of the causes of dementia. And you know, the one of the causes that can is heavy metals, copper, iron, pesticides, other things that you are saying are sprayed in the area. It's what they are asking people if they came up with Parkinson's dementia or disease at Camp Lejeune. So these things, yes, they can lead to, I haven't seen any direct correlation to Alzheimer's as such, but some of the other dementias have been shown genetically to have a proclivity to those dementias through exposures.
Well, you know, we got to do our own research because some people don't want to lose their money.
Well, absolutely.
Off of some of these chemicals and products that they're having out here. You know,
this is what we're trying to start with the Muslim Health Consortium. Right now, we just want to debunk a lot of falsehoods and conspiracies and whatnot with fact. And inshallah, in the future, people can, believers can pick up the ball and do our own research. But right now, we're just exploring the research that's out there from inshallah, an authoritative perspective, one that is sensitive to people and not just to profit. So thank you for your comments, sister. And next question.
Dr. Rashida Muhammad.
Hi, assalamu alaikum. Yes, I had a question. You talked earlier about tests and screenings. And generally, after blood tests, my doctor will just say something like, do you have any thoughts of suicide or depression? And that would be the only thing in terms of mental health that she would ask. So I'm wondering, what kind of test should I say to the doctor? Oh, do I need this test in addition to all the other kind of standard tests they give?
Okay, that depends on the complaint you presented with.
Okay.
If it was mental status, or if it was memory, or anything like that, he will go into you know, some of these neuropsychological testing or mental status tests or neurologic tests. But if it was just a regular checkup and he was just doing a general screening,
yeah, he
would just ask you, do you have depression? Do you have mood changes? Do you have other things? Just to check your emotional status and your mental status. So he won't go into these particular tests unless there's an indication. And that's based on the complaint that you bring. So it's important to have somebody with you so they can present, well, no, it ain't like that with you. I've seen you about, you know, something else, or write it down so that a lot of times we give it from the doctor that, you know, our minds go blank.
Right.
You know, or we get anxious and we don't remember all the things we wanted to say. So write it down, have someone else with you, and the doctor will be guided by the complaint that you present with.
Okay. All right. Thank you.
Yes.
Assalamu alaikum.
Wa alaikum assalam. Next question.
Yeah, brother Lassay. Then we have brother Anthony, then sister Thelma. Brother Lassay, go ahead. Okay, we'll come back to brother Lassay. Go ahead, brother Anthony.
Assalamu alaikum, Dr. Ramadan.
Wa alaikum assalam. Good to hear you.
And boy, talk about missing stuff and start stuttering. There was one thing that I wanted to ask about on people who are suffering some of the symptoms from stroke. Follow that of Alzheimer, you know, the behavior, I remember one brother I didn't realize he'd had a stroke, and he stayed so angry with me, and I wondered what was going on. And then my brother had a stroke, and he was telling me some of the symptoms he was going through, behavior and crying, and next thing you're happy, and a lot of things you described there as Alzheimer is also, do they go through tests to find out what's Alzheimer and what's been a stroke?
Yes, very good question. And, that's why we did we mentioned the different kind of scanning, the MRI and the CAT scan and the PET scan. And, there is, so the stroke and trauma and a tumor can give you symptoms like this. That's what we mentioned in the lecture. You can have, especially what we call multi-infarct dementia. Okay, multiple little strokes, not a big stroke where you can't move your one side of your body, but little strokes, and they show up on a CAT scan. What we call a lacunar infarct, and and these strokes can occur any place in the brain, and they can occur in the area of emotion and memory and mood, and so. Yes, strokes can appear like this, and that's why they have to be ruled out. And as I said,
Brother with what do you call temporary
transient ischemic attacks, TIAs. Those are temporary stroke-like symptoms that clear up within 24 hours. They are you can look like you have a stroke, but then it disappears. Get to the hospital. That was a warning to you. This happened. I couldn't move, and yeah, move. So you're all right. No, you're not. You've been blessed. You've been blessed to have time to get it corrected. So that's a transient ischemic attack. One area in your brain suffered from lack of oxygen for a short period of time, and it cleared up. Okay. But that is still an area at risk.
Thank you, Dr. Rahman, Dr. Sister Sharon, and Mas Cares. Thank you. Assalamu alaikum.
Next question. We have to show.
Next we have Sister Thelma, and we're gonna, in respect of the time, we're gonna wind down the question because I see more and more hands are raising. So, Dr. Ramadan, if you don't mind, it looks like you have time for it. Looks like 4 more hands.
Whenever you want to call it, yes, sir.
Okay. We'll stop it after the 4th one. That looks like Brother Jamal. And then on the YouTube side, for our YouTube audience, if you have a question, we'll take one from the YouTube audience. But we'll start on this side with, I believe it's Sister Thelma.
Assalamu alaikum. I'm from W.D. Muhammad Islamic Center in Greensboro, North Carolina. My question is, I hear a lot about ear ringing that they say can cause Alzheimer's and Parkinson. Do you all know if this is something that you should look out for?
That's tinnitus. Tinnitus,
yeah. Mm-hmm.
Okay. I know that it's part of the workup, but how it can cause it, unless it leads to depression, and it leads to all kind of anxiety problems. But any other specific link, I'm not aware. I'd have to check that. So that's all I can say. Do you know anything on that, Sister Sharon? Okay. All right. Thank you for your question.
You're welcome. Thank you.
Assalamu alaikum.
Next we have, I'm not sure
Brock,
that
you
is
want some
speaking.
fish?
Who's speaking?
And some chicken?
This is Sister Neophia.
We're gonna
Sister
confess
Neophia,
you
we'll
some
take
fish and
you, I'm gonna mute your mic, but I'll call
What
you after we have Sister Nichelle, we have Brother Jamal, then you'll be next.
Okay.
Sister Nichelle?
Assalamu alaikum, everyone.
Well,
Imam Muhammad II, Brother Adil, and my good friends, Imam Dr. Ramadan and Sister Sharon. Thank you so much for this beautiful, very informative presentation. I just want to mention, try to be brief. I remember my mother saying many times to us when she'd forget something or whatever, that she was going senile. So that was also one of the terms that they used to use that before we knew about dementia, generally speaking, knew the terms dementia or had heard of Alzheimer's. Even before I heard of old timers disease, my mother always used to say something about going senile. And then even when she did get to, she'd kind of joke about it, but when she started to get older and say certain things that were concerning to her, but we would see how sharp she was, in other areas. We didn't really, we said, oh, mommy, you fine, this and that, was nothing that we thought that she should be concerned about. Much later in, when she would have certain symptoms, I know I always had heard about Alzheimer's, people who were diagnosed that we knew, whether family members or friends. And I kept hearing the same things over and over again. Oh, the person started disrobing, taking their clothes off in public, or they would leave and get lost. And they didn't know family members, they didn't recognize their children. So those were the three main markers. And my mother had none of those symptoms. So I never suspected when she started to have some like mild hallucinations or her behavior would be erratic. I said, maybe she has some underlying infection or, something going on. She's having a little fever or something that's making her behave this way. I never, and I had recently read, well, shortly before she started having this, I think she was in her 80s, and I had read some article saying that if you pass, I think 70 or something, I can't remember what the age was, but I know she was well past it, without having these symptoms, then you're likely not to have it. So I kind of just thought she was in the clear, and I never saw any of this type of behavior until, and I had been telling some of the other one of the doctors she had at that time, the symptoms that she was having, and asking them to check to see, sometimes I took her to the ER to see, if she was having any infection. They said she was fine. So I talked to her primary, and they never really raised any flag until I changed her doctor. And our doctor actually is a Muslim in our community who was doing house visits, and only house visits. Dr. Aziz came by, and his first time seeing her, he was saying some of the symptoms that she had, like physical symptoms. He was saying she's not really having that. That's the dementia. And I said, my mother doesn't have dementia. And he said, oh yeah, definitely she does. And he was giving me some of the signs. And I was like, no, like how he knew in the exam. And so then after he left, I started putting two and two together, stringing this erratic behavior. So I quickly related to, oh, okay, that's why this was going on. When I shared it with my family now, they were very much in denial. They were very angry with me for suggesting such a thing. And that's one of the things that I wanted to say to the community as well, that can prevent, getting appropriate treatment when the family members are in denial. My mother had been saying for a long time, I think I'm going senile. I'm going senile. This is going on and this is going on. And we kept saying, you're fine. So I had had partially been in denial because I didn't see anything. But once she had the diagnosis, I quickly, like within that same day, believed it and tried to convince it to my family member. And it's like I became public enemy number one in my family for suggesting this, until many years later when her symptoms were severe. And they would visit her, and sometimes she didn't know them, or she'd be acting out a certain way. Then they would say, well, why did you say that she had dementia? What was going on? So I just wanted that to be something that we look for in our loved ones, that we as we see these symptoms that you guys have all mentioned, that all of you have shared with us, to be, you want to respond, Dr. Ramadan?
we'd like to thank you. First, I want to mention that you, Sister Michelle, is a member of the Muslim Health Consortium too. We appreciate always her contributions. And two things that I want to highlight what you mentioned is that one is that it's important to change your doctor. Change your doctor. He can become just like your family members, used to seeing the person all of the time and figure that's the way they are. No, and then you go to another doctor and says, whoa, this is so obvious. Look at that. Look at this. Look at that. In the same physical exam, neurostatus exam, neurologic exam, and mental status exam, and he can see a whole nother thing in the patient. And two, the families, no one wants to say that the family member has dementia, you know, and we a lot of denial, just as you said, and that's why you always got to say, what are the facts? Well, we see this occurring, and we see this occurring, and we see this occurring. You have to, in your own way, be analytical and observe the evidence, and then put it down. You know, so otherwise you'll say that's mama or that's dad or that's uncle and they've been like that and that's just old timers. And no, that could be covering up a lot of things. So I hope that's what we wanted to highlight in our presentations. So again, thank you for your comments. Next question.
I'm sorry, I just wanted to add one more thing with the I'm sorry, maybe two more things. What you mentioned, the multi-infarct and being a part of the research. My aunt was a part of the they were just following people, you know, who had old age, and she was a part of it. And it was a blessing that she was a part of it, because when she had a sudden decline and had a car accident around it, she was on her way to a meeting thanking them. And the police never informed us about her, you know, accident, but the people in the meeting, you know, where she was going, where she had been involved in the study, they were the one who informed us that, you know, something had happened, and we were able to respond to it. And also, I just wanted to say that with my mother, what I think that delayed her, you know, going to, you know, into it severely, what assisted was keeping her brain active. I remember hearing the doctor saying, try to remember several phone numbers a day that you dial, you know, that you don't just, you know, use your smartphone or whatever, or just tell Siri or whoever it is to dial it, that you remember certain, you know, a few phone numbers that you remember and that you dial them each time. Read, try to learn something, keep your brain engaged. And I also wanted to ask a question about the role of antioxidants, just in general, helping to, you know, to prevent.
Absolutely. Antioxidants are great. The blueberries are great. Other antioxidants are great. You know, they fight aging to an extent. So yes, they are, and that's also brain aging. So I don't know any direct quantitative impact, but they are part of the good diet, and they play a good role in keeping us younger. So thank you very much. Oh, and also other thing came to mind is those brain games, you know, crossword puzzles and other things like that to keep you thinking, keep learning chronic IATs, and you know, and the more active, just like any other muscle, if you don't use your brain, you'll lose it. And it's not through Alzheimer's necessarily, but you know, you can improve your thinking skills, which is a thing that we do test when we do mental status. Okay. Thank you. So we got one question up there we see.
We have Brother Jamal, then we have Sister Neofi, and that'll be it, inshallah.
Assalamu alaikum, everyone.
Walaikum assalam.
Yes, my name is Jamal Dean Bilal from New York City. Thank you for the presentation. In New York, and I'm in the city, and I see from time to time, they put the missing person flyers on the poles and things of that nature. And sometimes it says, a lot of times it says person suffering from dementia, maybe Alzheimer, but I know it says dementia at times. So my question is, individuals that become missing, is it because like maybe in the middle of the night, they kind of get up when everyone else is sleeping, or family members kind of, we're only human. And if you're taking care of an individual constantly, it can be taxing on you as an individual or family. In your history, is it because families maybe sometimes get a little lax or just get burned out, or is it something where the relative may just leave in the middle of the night or something? Because I always say, how can this person be missing, especially in today's times with so many cameras, and how come they haven't been, located, or where they have to put this, poster on a pole or something? Can you all speak to that, please? Thank you.
Mr. Sharon.
As you talk, I think about those scenarios where this is the time when your support systems have to be rallied. If you come from a family of multiple siblings, and it's so important to nourish your relationships earlier in life. And so when it comes to that point, everyone's okay, we've got to rally to help whoever this is going through this process. But yes, caregivers do get tired and burnt out. But it's also important to stop, say a prayer, and say, we've got to see this thing through. And yes, put some extra locks on the door if you think you have a wanderer. Yes. So inshallah, I hope that answered your questions.
Yes, thank you very much. Assalamu
Walaikum assalam.
I don't know if Brother Jamal mentioned, but he has a book out.
Hey. Actually, that's not my book, brother. That's the sister book on the back.
Oh,
It's
yeah,
a
that's a sister's book. Oh,
Dr. Dewan.
okay.
I think it's one of her first books. I'm glad you got it, brother, man. I thought maybe that'll help you with your grandkids. But alhamdulillah.
Well, I don't have. I wish I did, but tell my children I need some grandkids.
Yes,
I hope if some of them listening, I hope they hear me, because I'm tired of waiting.
Yes, that's Sister Dewan. I think her name is Fatima.
Yeah. I'm sorry, I forgot about it. But my time, I looked at it and I noticed how attractive it was, and I do know somebody with, young grandchildren, and so I kind of tested on them. You gave me 3 copies, so I gave them one. They immediately asked for another one, so I said, I know these are for sale, so y'all need to go to her site and buy her book.
Yeah.
I think it's something that's going to catch on if it's not as popular. I don't get around much, so I think it's going to grow in popularity, because a lot of young people have emotional and issues, and people don't have time to give them the attention they need. Yeah, alhamdulillah.
Yes, inshallah. I do have a book that's hopefully going to be published soon called Family Relationships and Family Matters. So inshallah.
Yeah, but we'll talk. We don't want to take up too much time. I appreciate it. I just letting you know I got the gift. I appreciate it. Thank you.
Yes, sir. Thank you.
Sister Neophil, this will be our last question from the audience, and then we'll let, inshallah, the Muslim Health Consortium close out.
Assalamu alaikum.
Walaikum assalam.
You can hear me, right?
Yes.
Okay. I really appreciate all this information that we're getting today. This is a load of information that we all need. It has been going through my mind for several years that maybe in the years in high school or immediately after high school, that as many people as possible should get a short course in caregiving. I was thinking about nurses aid, but maybe it needs to be a little bit broader than that, because it's a lot on one person or 2 or 3 people. Everybody needs to be knowledgeable. I think a lot of time people are neglected because they don't know. They don't know what to expect. They don't know what to do when certain things happen. And I think, 6 week or 6 month, I'm not sure how long the course would be, but a short course in caregiving would be an advantage to the whole society. And as many people as possible should take it.
Sister Sharon?
I would agree with that, sister. Remember that we have different stages of maturity. So some will receive it a little earlier than others, but I think every family member should be empowered to step into that role as necessary, since we are physically living longer. And as Dr. Ramadan alluded to, the baby boomers are here, and we're in need of some aid from the younger generations. Yeah.
And I would add to that. I think that's a good idea. We teach first aid. We teach CPR. I think family caregiving can have a little short area, but I think it would go a long way in orienting our population that that's a responsibility that we have, and you need skills in that too. And it would change our thinking. But we recognize first aid and CPR training, family caregiving would benefit us as well. Thanks. Thank you for that statement.
Okay, thank you, Dr. Ramadan. That was the last question. And I know I heard someone say about the wanted posters where you have people missing, but I believe they have the alert that they put out all over they have the amber alert for children. I think they have a silver alert.
Correct.
For adults that you see on the highways when you're driving, you get them on your phone, the loud noise that comes on the phone, the alert system. So I believe it's amber alert for the children. I want to say silver alert for the adults. And a lot of times the silver alerts are for people that are missing because of dementia, Alzheimer's, or other issues of that nature. The other thing, Dr. Ramadan, and I heard Sister Nichelle mention about like phone numbers, remembering things like that, trying to remember. How big is that? Like, because I always think about like the memorization of the Quran. Does that make a difference? Because I noticed like people that have jobs or they have skills where they have to remember like routes, like you have drivers that know routes. And I've seen studies of how like cab drivers in the UK, how they had all of these routes in their minds and how their memory lasted. So how does the memorization of things affect? Can you expound on that a little bit more?
It is just like someone going to the gym. You go to the gym and you do a workout, you increase the size of the muscles, you increase your fitness. When you use that brain and when you use that intellect, you do a mental workout, and you make it better to withstand aging and problems that it may encounter in the future. It is good, and it's good treatment as well. So, it's I'm definitely in favor of that, and I think the evidence supports it.
We're going to turn it over for you all to close it out, and we're going to proceed with the rest of the program, inshallah. Thank you again for both of you.
Sister Sharon.
Alhamdulillah. We want to thank you all for taking the time to, as family, to discuss something very important for all of us as a people. And inshallah, we will provide more opportunities to discuss this very important topic in our lifespans, inshallah. Dr. Ramadan.
I would second that. We so much appreciate this platform and this opportunity to share this information. And believe me, we learn as much from the questions, and we learn as much from the preparation of it. And we just thank Allah that to get this information out there. We think it could benefit the general population and certainly our community as well. Thank you. Assalamu alaikum.
And thank you.
Alaikum assalam.
Well, alaikum assalam. Priceless. I just want to give my my thanks and show my appreciation for you all doing such an excellent job with this program. that that the listening audience, that if you all benefited from this program today, let your family know this is a free program. It doesn't cost you anything. Let your loved ones, your community, and the spirit. I've known these believers here, the Imam Dr. Ramadan, for many, many years, most of my life. He watched me grow up as a young man, and his personality and his spirit has always been the same. And this is a safe haven for us. When you go into those, a lot of times the medical institutions, and when you visit your doctor, it's a lot of high stress and pressure. This, you can watch this once a month in your own living room, and you get an enormous amount of information like you did today, and that can lead to a better quality of life and happiness, and possibly save someone's life. So we're not just asking you because we want anything, but our job first and foremost is to serve in the best way that we can serve for the sake of God, for God's sake, so that, we're people of faith. So we believe that we're accountable to our Lord and Creator for everything that we do. And nothing would make us more happy to be, to improve the amount of good that we do. But we need your help. We need you to tell people to come on and join this program. And the forum is open, and we're a team. You see how we the floor is open for questions. The floor is open for any question that you might have. So, we thank Allah for you, and we appreciate your participation. But we love to encourage you more, because at this time of the technical time we're living in, that we think because we're on Zoom, we're still isolated. The information is here. We're fulfilling a need that's missing, is community. The nature of the human being is a social nature, and we're missing a lot of that. But alhamdulillah, we have the Mosque Cares, and we have the we have the Muslim Health Consortium, and we play a major role in the family life of the Ummah, what we call the Muslim community, in association of our late leader, Imam Wadathuddin Muhammad. And thank you again. And alhamdulillah, hope to see you all next month. Look forward to it. I'm gonna do a little research. All this information we get, I appreciate it. Alhamdulillah.
Walaikum assalam.
Alhamdulillah.
All right, so we're gonna turn it over to the next portion of our program, which is going to be Imam Elam Muhammad with the Quranic Arabic discussion. We still have a full program ahead of us. We're still looking forward to, after Imam Elam, we'll be hearing from Brother Abdul Rashid Akbar with the Business and Technology presentation, which will be followed by our Imam W. Muhammad II. And then with his normal commentary, we're looking forward to hearing that, inshallah. And then we'll get to our featured guest presenter, which will be our good brother Fleming El-Amin, inshallah. So with that, we're going to turn it over to Imam Elam with the Quranic Arabic discussion.
Assalamu alaikum, brothers and sisters. Today, we're going to work with the chapter Fusilat, which is a clear explanation. That's chapter 41. And I would say that like chapters 1 through 41 and more, but the first 3 or 4 verses, the words are very common. When I say common, you keep running into words, and pretty soon you understand them. And so with this chapter of Fusilat, I like to work with it, and what I like to do is put on the board some things. Let's see. Oh, that's just as I thought. My screen is frozen. I cannot share content. I should have came off and came back on, and then I would have been able to bring up the the whiteboard. And so we'll do it like this.
Ma'am, what are you trying to share your screen?
Yeah, I am trying to bring up the.
You have permission, so just hit your share screen.
Yeah, that's what I did, and it's not working.
Okay.
It's like my screen is frozen. And,
Okay.
and then I had, in order for me even to speak, I had to use the, what'd you say?
A little. It may
But,
be, it's okay. Yeah, okay.
Yeah, we can do what we have to do. First of all, is we're going to work with this chapter, but we've been able to develop because of the coronavirus. We were teaching Arabic almost 7 days a week, and we came up with a way to be able to teach roughly 70% of almost a year of Arabic in about an hour and 15 minutes. And we do that with the attributes of Allah. We take one attribute of Allah, they're nouns, but also they're used as adjectives. And so we would take one attribute and then we'll go step by step, teaching the Arabic grammar to where we wanted to complete. And without question and answer, it takes about an hour and 15 minutes. And so can you imagine if you learned 100 attributes and you use that process for each attribute, at a certain point in time, it will click on. And, obviously, if we teach almost a year of Arabic in an hour and a half, you're not going to remember it all. It's a step-by-step process. You still have to learn vocabulary. You still have to do some things. And then from that also, we were able to come up, which we're going to focus on now, how you narrow your scope when you read the verses of the Quran. You can take the Arabic language and they teach you about flying an airplane, driving down the road, what you're going to eat at the restaurant and so forth. And that when you start reading the verses of the Quran with different vocabulary, which is not Quranic vocabulary, your focus is all spaced out. And so we come up with a technique of what you look for when you read the verses of the Quran. And one of the first things you look for is a non-verbal sentence. That means you don't see a verb, but the verb to be is applied. I am, you are, he or she is. So if this is repetitive. So if I say Anna, which means I, Elam, it's I, Elam. Well, you have to translate it into English. It would be I am Elam. If I say Hua, which means he, Elam, it's he, Elam. Well, again, you have to translate it as he is Elam. So that is a nonverbal sentence. It's also called a equational sentence, a noun sentence. That's what it's called. But basically, you do not physically see a verb. So that's one sentence that you have. Then the next sentence is a verbal sentence. That means you have a verb. Now it's a sentence, so you have to have subject, verb, and the predicate or that which completes the thought. But in this case, it would be an actual verb like he did. Fa'ala means he did. Huwa fa'ala means he did. If I said huwa fa'alahu, huwa fa'alahu means he did it. And so it completes the thought. So then after that, you will look for, again, we're looking at about 5 things. You will look for prepositional phrase. So you have, in order to have a prepositional phrase, you have to have a preposition. So you have to learn what the preposition. And then you have to have the object of the preposition. And it's a prepositional phrase. And then you look for what is called adalpha structures. And that means possession. Rasulullah means the messenger of Allah or Allah's messenger. Ibadullah is Allah's servant or the servant of Allah. That's an Adolphic structure. And you will find the Adolphic structure in almost all the titles of the chapters of the Quran. Surah Al-Fatiha is an Adolphic structure. The chapter of Al-Fatiha. Surah Al-Baqarah is an Adolphic structure. And so you look for Adolphic structures. The next will be adjectives. And adjectives, just like in English, they describe the noun. However, in English, the adjective comes first. The big house, the big tree. Well, in Arabic, it will be the house big, the tree big. And so you will have to learn what adjectives are. But it's a blessing of Allah that with the attributes of Allah, they're known as nouns, ism, the names of Allah. And the best names of Allah is the attributes. So, but they also are used as adjectives. And so, because nouns and adjectives look alike. And so, again, that's an overview. I would have wrote it down on the whiteboard, the list of things, which I've mailed out the list. I mailed out the list of the 5 things that you look for. You can say, well, it should be a 6 or a 7, but majority, the 5 works real well. And I also have mailed out the step-by-step process of taking one attribute of Allah and teaching the grammar as we go. Like, for example, you have the attribute of Allah, Ar-Rahman and Ar-Rahim. Well, those are nouns. It'll be Ar-Rahmanu is indefinite. Ar-Rahmanu is definite. The merciful benefactor, a merciful benefactor. Ar-Rahim is the merciful redeemer. Rahimun means a merciful redeemer. And what's unique about those 2 words is there's 3-letter root, which is a verb. It's rahimat, which means to be merciful. So now you got a verb, you got to conjugate it. Then you go step by step through the process. So now that's the setup for the 4 verses, if we can do them, of the chapter Fusilat. And again, that's chapter 41. And like I said, these verses has words that you run across a lot. And so if we look at the first verse, letters of the alphabet, Ha and Mim. And the key to learn any language, you got to learn the alphabet. Whether it's Chinese, you got to learn the Chinese alphabet. The Japanese, you have to learn the Japanese alphabet. French, you have to learn the French alphabet. Spanish, you have to learn the Spanish alphabet. One thing about the Romantic languages, like Spanish and French and German, I don't know if German is considered a Romantic language, but at its root, it is Latin. Latin is at its root. And so you will find that the letters of the alphabet are almost the same, but they are pronounced a little different. But ours is Arabic. And so with Arabic, you have an Arabic script. So you have to learn what the A sound, which is Aleph. So it's almost like the A in English, A sound. You have to learn the Ba sound and learn what it looks like, and how it is affected by the vowels. So you have to learn the alphabet and how you apply the vowels with the letters of the alphabet. So once you get past the alphabet, now next you have to learn grammar. As Imam Muhammad says, once you learn the alphabet, you have to now you can teach the grammar. And grammar is the Quranic Arabic. And what's beautiful about it is the Quranic Arabic grammar sets the tone for the Arabic that they teach in college and that they use in government. And the Arabic language is not that difficult once you get past the alphabet and you start putting the letters together to make words. It becomes difficult when you take a college course and they don't tell you anything about the Quran, hardly anything in regards to the Quran. And like I said, and it's being translated into English. English is complicated. Arabic is not. When you translate it from different things that's in the environment into Arabic and into English, then you have to have so many rules of the grammar for the English language. And so right here, like I said, verse 1 is just ha and meme. However, it has a little sign over the meme that says make it a longer sound. Ha, meme. Okay, then the next verse, it's how many words? 1, 2, 3, 4. 4 words. And just like learning how to spell book, B-O-O-K in English, well, you got to learn how to spell words in Arabic. And so most of us suffer from a lack of vocabulary, even myself. And the Imam Muhammad mentioned that when you can learn all the vocabulary of the Quran, it will be like driving down the road with the lights on, and there's no darkness in front of you. And so you want to learn these words of the Quran. And there is a hadith that says, for 1 letter, you get a value of 10. So there's a word called wa. It means and it also means, it can be used as a preposition to say by. But here, verse 2, it reads, Tanzilun. Okay, this is a verbal noun, and it lets you know that you see the double dhamma at the end of it. It is indefinite. It is a noun, and it is indefinite. How would it be if it was definite? It would have a alif lam, and the last letter would have a dhamma. So it would be at tanzilun. Well, in this case, it's tanzilun. At tanzilun means the revelation, the revelation. In this case, this is indefinite, so it's a revelation. Tanzilun means a revelation. And as you learn Quranic Arabic, you're able to break this down into its 3-letter root, which is the noon, the zain, and the lam, nezala. And nezala means to send down, send down. So revelation is sent down, tanzilun. And then next, you have a preposition. Okay, so preposition, then that means there's a prepositional phrase. So min means from, and it's a preposition, it means from, and it preposition affects nouns, and the way it affects the noun is the endings of the noun changes. In this case, you have ar-Rahman. It would be ar-Rahmanu if there was nothing affecting it. Or ar-Rahman-nun, that means a, if nothing was affecting it. Well, this preposition causes you to change the ending of the last letter. The word means the same, it's just the ending. Instead of ar-Rahmanu, it's ar-Rahmani. So min ar-Rahmani. Now I just did some tajweed. Min ar-Rahmani. And there's more tajweed I could have did. You got tanzilun, Well, the meme, if you look at men, it has a shedda. That means there has to be two M's. That first M has to go somewhere. And then so instead of Tanzilun, the sound is changed to Tanzilun min ar-Rahman. If you said Mina and then ar-Rahman, ni, okay, yeah, you're getting towards the tajweed. But here's the preposition. The preposition is min, so it's from the merciful benefactor. From the merciful benefactor. And then the extension of this prepositional phrase, ar-Rahimi. That means man is affecting ar-Rahimi, the merciful redeemer. So in this case, if you were to read it literally, it says revelation from the merciful benefactor, the merciful redeemer. There's no verb that you can see. So you would, to translate in English, it'll be a revelation. This is a revelation is from the merciful benefactor, the merciful redeemer. So this is a sentence that does not have a verb in it. It's a complete thought. But it's a non-verbal sentence, so you have to use is. I am, you are, he or she is. And it's a complete thought. A revelation is from the merciful benefactor, the merciful redeemer. So the subject is a revelation. The verb is, and that which completes the thought is a prepositional phrase. Min ar-Rahman ar-Rahim. All right, so the next, okay, so if you look at the translation, I usually use 3 different translations. Say International, that's the one that even the Saudi Arabia has approved to some degree. So you'll find it on the internet a lot. And their translation, these are 3 women that converted to Al-Islam, and they translate the Quran, and it's used a lot on the internet, and they're pretty much, they're close to like college Arabic, college Arabic. So I used 3 translations just to look at it to see what has been said. Pickthall, Imam Muhammad, he would use Pickthall, and Yusuf Ali. And there's others. You mentioned, Imam Muhammad mentioned that you should look at others. So in this case, it says, a revelation from Allah, most gracious, most merciful. The translation that I use is, a revelation is from, see, Allah is not in this verse. They put that in brackets. They added in to try to give you a much more clearer understanding of, or the spirit of the Quranic Arabic. But Allah is not there. It will be Allahu. So it's a revelation from. So what you see, a revelation is from the merciful benefactor, the merciful redeemer. And again, the translation that they have, a revelation from Allah, most gracious, most merciful. And that, I believe, is Yusuf Ali. The next verse, and I got about 10 minutes. The next verse is a noun, and it's indefinite, just like the verse 2, Tanzilun, it was indefinite. If it was definite, it would be at Tanzilun. Here, verse 3 is Kitabun. If it was definite, it will be al-Kitabu, which means the book. But Kitabun means a book. And then, so it is the subject, nothing affecting it. So it tells you that it is the subject. Then the next word is fusilat, and it is a verb. So that tells us that we have a sentence that has a verb that we can see. Fusilat means explained in detail. So a book explained in detail. Then ayatuhu It's signs. Ayatu is plural for ayatun, or ayatu, or ayatun. This is plural. Ayatu. It will be ayatu, but because it has a pronoun attached to it, it's ayatuhu. So signs, and then has who means it. Its signs. Its signs is Quranic Arabic. So really it says, let me go back a step. Kitabun, it stops out. You can stop there. Kitabun, maybe if you want to maybe put colons after the word like kitabun. But the subject is ayatuhu, its signs. And a lot of times with the verb and the subject in Arabic, the verb comes first. Now you can have the verb can come after the subject, but a lot of times the verb comes first. And so fusilat is feminine. Fusilat is feminine. Kitabun is not feminine. Ayatu is feminine. So ayatuhu. So it's the signs is explained in detail. And then what is explained in detail? The object, which is Quranic Arabic. It's indefinite, Quranic Arabic. Quran means the Quran. Arabic is the adjective. And adjectives look exactly like the noun that it modifies. And really what you see, Quran Arabic. So Quran Arabic, but to translate it, you have to say Arabic Quran. Arabic Quran. Then you have, I got about 5 more minutes. Then next we come up with a prepositional phrase that has a verb in it. Likaumin. 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 Kaumen. Al-Kaumu is the people. And it means people that are established, as the Imam said. They're established people or standing people. They have establishment. To Kaumin, Likaumin Ya'lamu. Okay, Ya'lamu is a verb, and the subject will be they know. They know. So a people who knows. To a people who knows. That's your prepositional phrase, to a people who knows. So a book explained in a book, its signs explained in detail, an Arabic Quran to a people who knows. They know, the people knows. Then number 4, you have Bashiran. Bashiran means giving good news, and Wa means and Nadiran means warner or admonition, they translate here. Good news and warning. Then Fa Rada, that is therefore, it's a verb. Rada is a verb that means turn away. Therefore, turn away. But what's the subject? Ektharuhum. Most of them. Ektharuhum. So you would translate it. Most of them, therefore, most of them turn away. And then finally, another verbal sentence, but it has a negative. La means to make a sentence negative, no, negative. Fa, whom. Fa means therefore or then. And it means something that will happen more quickly. There's another word that means therefore is thumma. That can happen over a period of time. It could be years, days, months, years. This one is more sentence. So most of them, therefore, most of them turn away. Then you have fa again, therefore, they. Fa is therefore, whom is they. Then lad is going to negate the verb that follows it. So this is a verbal sentence, but it has a negative in it. Therefore, they do not listen. Therefore, they do not listen. And so I did the best that I could without writing it on the whiteboard. Hopefully, you were able to follow it. I do have, we've got roughly about 20 people that will get certificates for a level of completion. And pretty much they should be able to teach the way that I'm teaching right now. And so we welcome anybody else to join our class. And we have to find out what level you're on. We'll get you to, step by step to learn the alphabet, then finally start learning words, then start learning the grammar. So you don't want to be a parrot. You don't want to be reciting Quran from transliteration with baby wheels. And most of the time, those transliteration is wrong. I mean, some part of it is wrong because your pronunciation is going to be wrong. You have to be able to use the Arabic script and be able to pronounce it correct. But not only that, you have to know what you're saying, understand what you're saying. And that's what the Imam Warfi Muhammad wants us to be able to do, to read and understand and not be like a tape recorder. And the tape recorder, I mean, there's some tape recorders, they can be almost accurate, totally accurate. But you ask them, what did you just say? I don't know. So with that, I give everybody the greetings. Assalamu alaikum. I hope I helped some of you as best as I could.
Yes, sir. Thank you, Imam Elam, for that. And we're going to go, and you shared your information already?
Yeah, if you could you share your link or the email so that those people that didn't receive the information, the email that you sent out, how can they get on your email list?
What I'll do, I don't do it often. I mean, we got 67 people that we trust. I'll give you my telephone number, and I can't write it, so I'll just give you my telephone number, and then text me your name, telephone number, and email address, and then I'll get back to you, and I'll send you my information. My telephone number is 517-282.
You said 70 people, man. I mean, I'm talking to the Zoom audience. We do have a YouTube audience now too. So
oh yeah, that's right. All right.
Yeah. Just that was really my reminder. That was a hint.
Yeah.
When you say you email people, that's public. So you can have people visit your right
email.
If you want to enter your email in the chat, and then
email it in the chat.
Well, would somebody else do that for me? Because like I said,
we'll do it.
I'll do it now. If you just
I'll give it to you. It's Rafia.
And then when you do voice it, the YouTube audience will hear it. They'll hear your email. So I'll be entering as you voice it. Yes, sir. I'm ready.
Okay, Rafia1. That's RAFIAH1 at M as in Mary, S as in Sam, N as in Nancy.com, MSN.com. Rafia1 at MSN.com.
I think your granddaughter put it in there. I heard she say, "Excellent job, Granddad." She put it in there. She beat.
Oh, that's my granddaughter, huh?
Yes. She's on it. She got you back. Alhamdulillah. Yes, sir. So, okay, Imam Elam, it's in the chat. For those who are listening on YouTube, you can, if you're interested in Imam Elam's Quranic Arabic discussion course, you can email him with your information, your phone number, and your email address for his correspondence at rafia1@msn.com. That's RAFIAH1@msn.com.
Thank you, Imam. Thank you, Imam Warfi Muhammad.
Excellent.
It's good to see your grandson.
Yeah. Hey,
oh yeah.
Ain't nothing like having your own team.
Yeah. And that was even one of my wife's students. She we've been inviting her to the class, sending out the email, constantly sending out the email. And I think she's going to go into nursing or completing nursing. She came in, and I hadn't seen her name on before, so she came in. So we just keep it sending the information out to all the people we know. If everybody will forward the information that we get about the First Sunday or any of our initiatives, send it out to 10 or 20 or 30 people, and keep doing that. That's a great help.
Right. And we own this. Our charity is we own that. That's the one thing that we say we own is the good works that we have and our charitable acts and what we do as a community. We should value that. And it's really good to see the younger generation stepping up to the plate. Because alhamdulillah, it's really heartwarming and it's beautiful to see especially our grandchildren participating in the great work, and we pray that Allah rewards them for their efforts. And they should know there's a special blessing in it for you. When you join to do a good act, a good work, doing a good work, you become a partner in it. So you become a partner of the stairs, alhamdulillah.
We were, Deal was asked, and myself was asked, the young brother that you know, Imam Warfdeen, he asked, he said, how do you become an imam? Well, Imam Adil with myself or Imam Adil or myself can help him. And we told him what we asked him what to do. And so his assignment is do the 5 pillars and 6 basic beliefs. And if he can get those down and be able to explain them, then inshallah, we're having to do Juma. And so we're looking for the young people to step forward so they can take our place.
Yeah, and it's beautiful to see that that they have the courage, even though we're not as accessible as we would like to be, and we apologize for that, but they have the courage to step up and speak up, and Allah always is near. He'll answer even the questions that you think there may not be an answer for. So, it's always good to step up and ask those questions, and we have people here that can help, inshallah. Yeah, alhamdulillah. That's good. Yes, sir. Okay. All right, so we're going, I see Brother Akbar, he's available.
All right, we're going to turn it over to our good brother, Rashid Akbar there. Thank you.
Okay, assalamu alaikum. Can you hear me okay?
Assalam. Yes, indeed.
Okay, well, I thank Allah for blessing me to be able to be here on the first Sunday again here at the Mosque. Even with the Muhammad, I thank you for continuing the initiatives of your father. I thank all the believers who are watching either on Zoom or on the on YouTube video. A couple of things I want to say before I start the presentation, and but they did help me with this. I'm on my iPad today, so what I'm gonna do is share the screen and try to get to these 2 videos I want to show. But let me first say that we're on our way back to Chicago. We're about half an hour outside Indianapolis, coming back from Kentucky, from Moorhead, Kentucky. We came down, my wife and I, we came down to support our grandson, who has completed his BA degree at Eastern Illinois University, but he was playing baseball. He had a baseball game down in Moorhead, double hitter, actually had 3 games, 3-game series. And he was going to have his graduation party down at Moorhead because he couldn't get back to Charleston just to walk and then get back to his baseball game, which he had a commitment to because he has an athletic scholarship. So we said we would come down and celebrate his graduation there in Moorhead. And other family members came down and we had a fantastic time. Thank Allah. So we're on our way back. And I told my wife, I said, okay, now I got to find a Starbucks because I want to use their Wi-Fi. And so as we were coming back on the highway, I said, okay, there's one. So we're about a half an hour outside outside Indianapolis, just south of Indianapolis. So I'm stopping here. And so I thank Allah for blessing me to be with you.
So you had a Starbucks,
Yep.
Man, I was feeling so happy. I was like, I'm out here doing the family thing, and here he is on the YouTube. You're on the public forum, everybody see, and you're encouraging people the beauty of marriage, the beauty of family, the beauty of how you enjoy the spring weather and everything. And I say, I might even look about 10 years younger. Yeah, but
Yeah,
don't tell me you smiling because you found your Starbucks.
no, I'm smiling because I'm just smiling because
I'm just teasing.
I'm able to.
That's a little inside joke. That's a little
I hear
inside.
you, but I thank Allah for blessing me to be with you all, being able to be with you on this first Sunday.
We thank Allah for you because we've been watching you and your wife on Facebook and your
That's great. That's great. That's great. Well, look, now,
I continue to bless you.
So Adil, I'm getting ready. I want to share my screen, but this is the first time I've done it on using my iPad and using sound. So I'm gonna work with it, but we're gonna get it, inshallah. Okay. So let me tap here. Okay, and share content, and I'm gonna share my screen. And I'm gonna start the broadcast, but I want to make sure I can share the sound. Now the sound here may come on automatically. If it doesn't, let me know.
It may be best just to go to the site and then just share it from there, and then it'll automatically share it as opposed to sharing it as a separate link.
Okay, but should I stop the broadcast?
No, you're good. Just try it like that, like you're doing it now. Let's see if we could get the volume like that.
Okay, so let me see.
If
all
not,
right, you can see my screen, right?
Yes, sir.
Oh yeah, it says share device audio on. Okay, good.
There you go.
Okay, good. All right, so now let me go to my let me go to YouTube. And this is where I'm gonna, so let me go to YouTube. So give me a that's not YouTube. Oh, social. Not social. So give me a second. There's social network. YouTube. Okay. All right. So, brothers and sisters, I'm always looking for an opportunity to increase my cash flow. And I want to also share this with those who are on the first Sunday presentation today. I want to share with you some of the things I'm looking at. It may be of interest to you to increase your cash flow and look for that next business opportunity. This is one that I'm looking at. So I'm going to share with you 2 videos today. Okay. And it deals with car sharing. And so the first one is going to be, what are the 3 best car share apps to do a car sharing? And then I'm going to share with you one of the young ladies who has her own YouTube channel. She's going to be one that I'm going to be doing research on, among others, because this is something that I want to be able to do within the next 2 to 3 years. Now you might think, oh, that's a far way out. But when you're looking to start another business, you want to take your time and do the research so you can be as successful as you can. So let me begin with this first YouTube video.
The thing that's different about a Verbo vacation home, you always have the whole place.
Thanks to Uber and Lyft, you can get from point A to point B with the touch of a button, but they aren't your only choices. Lindsay Granger has a few cool and creative car sharing apps you need to know about. Hey, Lindsay, show me your app.
From driverless cars to being able to order a luxury ride on Uber, car sharing is changing the way we live. I have some cool newcomers to the ride-sharing revolution. Starting with DriveShare.
It's just like Airbnb for classic and collector cars.
Want a brand new Ferrari for the day or a vintage 1972 Porsche like us? You got it. This app allows you to rent the classic car of your dreams right from a car collector in your area.
Tell me what occasions they might use it for.
Weddings, special occasions, going out on a date with that someone special.
Now, when I scroll through the site, what kind of cars will I see?
Oh, you're going to see everything from little old Porsches to full-size Bentley.
So pick your toy and get ready to turn heads. Vehicles are currently available across the U.S., ranging from under $100 to over $1,000 a day. Next, the new wave of car rental, Turo.
You earn cash every time it's rented. And you're backed by $1 million in liability insurance.
The app allows you to rent a car or list your car for rental, and you can arrange to pick it up or even have it delivered. And wouldn't it be nice to have a group of strangers help with your car payment?
It's basically helped pay off all of the payments, depreciation on it, so it's as if I got to drive it for free.
And they screen all renters and owners before any transaction. The service is available in all 50 states, and prices start at $20 a day. And get this, the car owner keeps up to 90% of that profit. And finally, a cool car sharing service called Hire Car.
Have you ever wanted to drive for Uber or Lyft but didn't have a car? Now you can. Meet Hire Car.
Just log onto the app, search for a car in your area, and pick the dates you want to drive it. The daily rates start at $35 and it's available in most states.
The only peer-to-peer car rental platform where you can rent a car to drive for Uber, Lyft, Postmates, or any other number of ride-sharing services.
And don't fret, the app conducts a background check and insures both the driver and the vehicle owner. Plus, each time you rent a car, you're assigned a personal agent to help answer any questions you might have. Those are just a few apps that are reinventing the way we ride share.
Okay, now let me stop that one. But they did. Could you all hear that all right?
Yes, sir.
Okay.
The volume, we heard everything loud and clear. Yes, sir.
Excellent, excellent.
Okay, excellent. Okay, so let me bring up the next one. And brothers and sisters, I'm going to make my comments after you watch the next one. Because Turo is probably going to be the way I go. So let's go with this. Let me bring up this one.
Most people have no clue that in 2023, the best way to make money on Amazon is not.
I made over $262,000 on Turo in just 1 year. It took me 8 years and thousands of trips hosted to figure out the most important things you need to know to run a successful Turo business. In this video, I'm going to take everything I learned in those 8 years and deliver them to you in just 8 minutes. This is 8 years on Turo in 8 minutes. Start the clock. Lesson number 8. In business, we walk before we run. When beginning a journey that requires new skills and financial investment, it's important to know if it's something you actually want to commit to. Now on Turo, I recommend you start as small as you can. See, when I first started out, I only rented out one car, and it was a car that I already had, this amazing little smart car. I did that so I could see if I actually enjoyed the business while avoiding the financial risk of buying a car just for Turo. There are a lot of lessons on hosting on Turo that apply no matter who or where you are. That's kind of what this channel is all about. But there are little tricks to the trade that are entirely unique to your own circumstances. And the only way to learn them is through experience. So dip your toes, experience Turo, and see if it's actually right for you. And it may not be, and that is totally okay. But if you're like me and you like how hosting feels, then that takes us to the next lesson. Lesson 7, research the cars. Oh, I cannot emphasize this one enough. So you enjoy hosting cars on Turo and you want to make it into a business. Now what? Well, you're gonna need cars, but these cars are not gonna be, flimsy joyrides or your favorite shade of green or your dad's favorite car from 1987, as much as you may love it. They need to be carefully chosen for their purpose, which is to make money. So based on the data available to you that you're going to gather from market research, you're gonna be able to determine which cars work well. You'll want to buy cars that have high demand on Turo's platform, that have a high profit margin, that don't depreciate too much, and also that have relatively low maintenance and low risk. It's also worth thinking about the kind of people that you want to cater to. So imagine the perfect car for their interests and why they might be renting from you. If you're imagining a couple that wants to seek an adventure and you're based in Colorado, then something like a Jeep or a Subaru is going to be perfect for your market. Or maybe you're thinking of someone who likes luxury and is visiting LA for the weekend, then maybe something like a BMW or a Tesla. So remember this. Buy cars that make sense for your goals and your budget, but most importantly, your market. You don't want to go off buying a dune buggy if you're living in Manhattan, because that just wouldn't make any sense at all. Lesson number 6, you want to get your Turo listing seen. Let me show you something. Would you drive this car? Okay, now what about this car? You can see that there is a stark difference between the two. So of course, these two pictures are of the same car, but because the second picture is better quality and more flattering, you would probably be more likely to rent it, wouldn't you? There is no point in having a good car if no one can see how good it is. And these days, sometimes even good isn't enough. In this world of endless content and distraction, you need to be amazing to stand out. So do that. Invest some time and resources in maxing out the presentation of your car in your listing and make it amazing. Make it so a customer can't look away, and that when they see your listing, they know that this is the car that they are absolutely going to book. So let's get on to the next lesson. Lesson number 5, provide the best customer service. This lesson is incredibly important. As a provider of services, you want your renters to have a positive experience with you as a host. If your car was clean and exactly what they needed, but you were difficult to communicate with and kind of just a jerk, chances are that your renter will find someone else next time to rent from. And that's not what you want, because you want that repeat and referral business, because that's how you grow your empire. Try to really put yourself in the shoes of your guests and imagine the kinds of things that you would want when you were renting a car. You would want someone friendly, accommodating, and someone that has great communication so you know exactly what to expect. Try your best to be those things. A happy customer is a customer who will come back, and a very happy customer will leave you a 5-star review raving about what a great host you were. And having 5-star reviews is a great way to stand out and secure your future rentals. Make no mistake, being nice to people is not a bonus. It's a part of the experience, so it's something that you really, really want to focus on. Lesson 4, protect yourself and your cars. If you've seen my previous videos, then you know that things can go wrong in this business. If we had more time, I'd tell you, but for now, let's just say in the early days of Turo, I had one too many conversations with the cops in the middle of the night, and that's something I absolutely do not miss anymore because I'm protected, so I don't have to deal with that stuff. So what do I mean by that? I don't want you guys to have to go through the same things though, so I'll tell you this. Make sure that you plan for risk, accidents, damages, thefts, and other things that could go wrong, and protect yourself with the right tools. One bad day could bring down your entire business. So it is extremely important that you understand how insurance works, how to maximize the protection you get from your Turo host protection plans. On top of that, you can add extra layers of protection with things like GPS trackers, kill switches, and so many more precautions that you can take. You can check out my website, powerhost.club, to get an in-depth walkthrough of the best ways to maximize your downside risk so that you feel safe and secure in your Turo journey. Lesson number 3, automate as much as possible. It's 2023 and the future has arrived. Tools of AI and automation can greatly improve the efficiency of your...
It's a fact. In the new economy, average people are becoming millionaires faster and easier than ever before. But how do they do it? According to the news, the whole world's falling apart. Well, that's the million-dollar question.
Business and your own experience of managing it. Turo has incorporated these tools into many aspects of their platform, and I totally encourage that you use them. Once your business reaches a certain size, you will probably also be able to begin outsourcing certain aspects of it. So for example, you can hire mobile detailers to come wash your cars, clean them. That way it really saves you the time and effort of having to do it yourself. My favorite way though to automate the Turo business is utilizing Turo's new automated messaging system. This system really ensures that your communication is on point with your Turo guests and that you never miss a beat. In general, automating as much of the tedious stuff as possible will let you devote more time and energy to things that actually improve your business in the long run. Okay, we are nearly there. Lesson number 2, networking. A common saying is, it's not what you know, it's who you know. I don't completely agree, but it's something to keep in mind. Some opportunities and knowledge are just not available when you start out and can't be acquired all by yourself. This is where you look to other people in your area to help you. Becoming a part of a community strengthens all the individual members of that community, and this is true for Turo as well. On online forums, you can learn from people with more expertise than you, and they'll be happy to help you if you ask them questions. Being part of a community will also mean you stay updated on the changes in the Turo world, which is important if you want to build a sustainable business over the long term. Plus, it's just nice being a part of a community. It's It's nice to help each other. I personally love to have you in my community, which you can check out in the details in the description down below. And finally, lesson number 1. We are there. You want to enjoy the ride. What's the point of it if it's not fun? I began my business on Turo to get away from the same old 8-hour indoor routine and to take my life in a new direction. Now I'm regularly on the move, talking with lots of different people. I get to creatively expand my business in a way that I want. I also get to use the platform I built to help you guys do the same and to make a positive impact on this community. One of the best things about starting your own business is that it's a journey and every day is another step forward. If you work hard, you'll succeed, but it can also be easy to become too focused on tomorrow and to always be stressed out about the next thing on the horizon. It's important to savor the little things, not to take yourself too seriously and just to enjoy the ride. And that's everything, guys. 8 years of my hosting experience in 8 minutes. Check out this last video I posted about how I made $262,000 in just 1 year on Turo and get the play-by-play of how I did it.
Okay. Okay, so I'm gonna stop my share. Okay, I'm back. Assalamu alaikum, brothers and sisters.
Assalam.
Okay. Live broadcast is gonna have stopped. Okay. All right. Let me tell you how I came familiar with car sharing, particularly Turo. I was working, as most of you know, I go to Phoenix, Arizona in the winter. I was at the airport and I saw people would drive up, they would get out of their car in the parking lot and they would start taking pictures of the car. They walk around the car and they were taking pictures of it. The next thing I knew is somebody else would walk up and they would give them the keys and they would get in the car. And the person who drove up with the car, they would go get on the train or something and leave. I saw this 3 or 4 times. I saw it one time when somebody drove somebody up and they did the same thing and they got in the car with the person who drove away. So one day, a young brother came up and he was asking me about my car. And I said, so what do you do? He said, oh, I do Turo. I said, what is that? He said, I got 5 cars on Turo. I said, what is that? He explained to me what Turo was. And he said he started out doing ride share like I'm doing. He said, but I don't do that anymore. I just come up here to drop off cars and pick them up. And from that conversation, what the young lady said about networking is really important. I had another young brother come up to me, ask me about my car. It's interesting. And he also did Turo, but he wanted to ask me about my car and ask me, how much can you make with it and this and that? And so I would give them information. And I asked them, I said, don't these other drivers share things with you? He said, no. The guys don't want to talk to you. They don't want to give you no information. They don't want to, I said, well, you can always come and talk with me. And so I asked him about it. He has 3 cars, Turo, 3 cars on Turo. And he said he also does ride share. So that's when I started doing my research. And I'm going to continue to do it. Because inshallah, one day, I don't want to have to do ride share anymore. Now, let me tell you, I enjoy driving. I enjoy meeting people. But if I can make more money just renting out my vehicles, that's what I want to do. It can free up my time to do some other things. All right. So I said, as the young lady said, she started with her own car, with one vehicle, with her own car, it was paid off. So I'm looking at maybe 2 years at the most, maybe starting my Turo business, inshallah. Now, Allah may bless me to be able to do it sooner, but that's my plan. And as I go about this, I'm going to continue to come back and share with all of you here on the first Sunday my progress, what progress I'm making. But one of the things I learned from listening to her videos, and you can just go to YouTube and put in car sharing or Turo, and you'll see her website, her information that comes up. She has some excellent videos. But one of the things she says if you're going to take some advice from someone, take some advice from someone who's been doing Turo for at least 3 to 5 years. Not someone who's just started, but someone who's been doing it at least 3 to 5 years, because they've got the experience. They've had the ups, the downs, the problems, and stuff like that. And so, as she say, you don't want just look at how she made $200 and some thousand in 1 year. You also want to know what have been some of the downfalls, so what have been some of the challenges she had with her business, and but how she overcame those challenges. So, brothers and sisters, this is what I wanted to share with everyone here on this first Sunday in May. I thank Allah for blessing me to be able to be with all of you this first Sunday. And so now I open up for any questions and that I may, or comments that anyone may have here on the Zoom or on the YouTube. And thank you again, Brother Imam Wazir Muhammad II, for allowing me to present here again on the first Sunday.
Mm-hmm.
Yes, sir. Yes, sir.
I missed it. What'd you
Please,
say?
thank you.
Well, thank you. Yeah, alhamdulillah. Yeah, I'm learning, so I'm over here picking our deals, man. He know a little bit more about this than I do too, but that's amazing. I'm sitting here telling him, do I need to put my car in the shop and get a check because the heat wasn't working last time, but I got a car just sitting around. I couldn't give it to my son. I guess, I don't know, it wasn't good enough for him, but
yeah.
It was meant for me to have. I figured I offer somebody something and they don't take it, it's meant for me to keep. So,
you're right. You're right.
so
But it really is something I'm gonna look into. The technologies has made it easier, and so about 2 years time, I looked to start at least my first car on Turo. If I don't find a different platform, there are several out there. There's Turo that's good around, but the Turo I think it's the largest, and I think more people use it, and so that's the one I'm gonna be looking at.
Brother Akbar, did you open up for questions, or did you?
Yes, I'm open for questions. I'll respond to as many as I can.
Okay.
And then I want to make a couple of comments before we complete.
Jawad, do you have a question or a comment? Okay, for those who have a question or comment for Brother Akbar, you say you want to do that, make your comments after the questions, Brother Akbar?
Yes, I'm gonna make my comments just before I leave.
Okay, yes, sir. So please raise your hand in the chat for the questions for Brother Akbar. We'll answer the question by hands raised. Go ahead, Brother Anthony.
Assalamu alaikum, Brother Akbar. Brother
Anthony. Yes, sir, Brother Anthony.
This is what's going on nowadays. You just prove, don't worry, ask Allah, and it shows you different ways. Never heard of this, and you know, I was just thinking, says, okay, I need to make $1 million just the other day, but I can't go out and leave home just because of different situations here. But how people are able to, and that was a big thing here, people working from home, and especially women, and especially women with families, because they go to the office to get abused. But this is just another that we learned from the very beginning when the Honorable Elijah Muhammad, to do something for self. But it's amazing what's going on nowadays, that how people are thinking and doing things, and the corporate world abused everybody. But this is, I mean, my mind just started racing here, and I had to say, wow. I can say Allahu Akbar, because no matter what you're doing right now, if you got a decent mind, you can make money.
Yeah, absolutely. You can.
That's, I just, as always, I say you bring us $1 million ideal, and if you were in a commercial circuit there, you be making a lot just off of your lectures. Assalamu alaikum. Thank you for you.
Thank you, Brother Anthony. Thank you.
All right. Any other questions or comments for Brother Akbar in the business presentation? Sister Sharifa, your mic is open. Did you have a question or a comment?
Yeah, this is Muhammad Sharif, Brother Dio.
Yes,
Yeah,
sir.
Brother Akbar, Imam Wadi Imam II.
Yes, yes, Brother Muhammad.
And Imam, you had just spoken a few minutes ago, you said about you had the one car and wasn't giving you heat or anything like that. I know you had given us a tour of your property a few months ago, and you had a whole lot of cars there. I thought maybe
No, there's a difference. I got investments. My classic cars, you can't rent or buy them unless you got cash, and they're not for sale right now. Yeah, those investments everything I got is something. I still have original stuff that I got. My first job that I bought, things I bought. I'm one of them type of people that Allah has blessed me to value things. And if my wife hadn't passed, I would have the same wife. You know, I tell people this all the time. The reason why I got stuff, because I take care of what I get. I don't buy no junk, and I take good care of it, and I keep it. I still had the first vehicle that my father bought when I started working for the ministry, my van. My 99 Plymouth van, it's got 150,000 miles on it, but it run good. It's really, I have a sentimental value. They asked me if I wanted to sell it. Now they don't even ask, because it's half of it is rust, but the transmission, the engine, and the seats still work. And I load it with things that I don't mind loading into it. And I also have a 2021 vehicle. But you know, the other vehicles, I tell my children all the time, when my young ones, they jump in there with me, and I tell them, I said, do you know I paid $20,000 for this car back in 1999? You know, and I paid a note. Yeah.
Yes.
So my car actually it was my father bought it when he bought it with the ministry's money. So it's really the ministry's car, that Equinox. The problem with the heat, I'm not gonna name the place where I was taking it. They refused to fix it. So so I wait till it got warm outside, and I'm gonna start back driving it.
Right.
Okay.
Yeah,
that's what's going on. I got a lot of stuff. Allah bless me. I own properties, I own vehicles, I own other things that might not be valuable to you, but they're valuable to me. And I think anything that you can polish and clean up and take good care of, if you pay money for, somebody else might want to pay money for. So everything's for sale. If you want to come see me again, bring your pocketbook.
Okay, all right. Yeah, thank you for the explanation. So, Akbar, I'm glad you mentioned and showed us about these different businesses. One thing the lady said about networking. See, that's where we seem to be taking off actually what's going on, because they show us pictures of individuals, like the president of a bank or something like that, or whoever may be. But they don't never tell you too much, but there's a team working. Not just that. And we try to do things by ourselves. We don't come do the networking. It's a team operation, so I mentioned that.
Absolutely. Very important. Very important. And it's important to build your network. Don't be afraid to ask people about something, because I'm not. And then be open to give people information. When people walk up to me, out there at Sky Harbor Airport out there in Phoenix, they walk up to me and ask me about my car and everything like that. My perspective is this. Or ask me about my business. What I do is to give the information. Allah blessed me with it. He didn't bless me to hoard it. He blessed me with it, and it's beneficial to me. So I'm going to give it. I'll give it out fully. And I tell people, you can't pay me for this. Now, if you want to rent my vehicle and take advantage of my transportation business, I'll charge you for that. But for my information, I'm not going to charge you for any of it, because Allah has blessed me with it, and I didn't get charged for it. And so I'll give it freely. So networking is really important. I agree. Really important.
Thank you for taking my comments. May Allah bless us with more success.
Alhamdulillah.
Brother Akbar, we had somebody on the YouTube, in our YouTube audience, Sister
Yes.
Nina, she's been using. She says, Assalamu alaikum. She's used Turo for years. She says it's a great service. Wow.
Alhamdulillah. Yeah, because you can do it on both sides. You can rent, or you can have your cars to rent to other people. You're right. It's excellent. It's an excellent service. All right, Brother Adil. So let me first make sure that no one else has a comment or question. Then I want to make.
I got one. So so if they're using Turo, what's the average use of it? Do they keep the car for a day, a weekend, months at a time, or years?
This what they do, brother, ma'am, brother Dean. When they go to the on the Turo app, they look and see how the individuals have listed their cars, and it's up to the individual who list their cars to determine what they're going to charge for the car, a day or a day, how many miles can be driven on the car where you have it, how long you can keep the car. They may say, my car is only available for a 2-day rental or 3-day rental. Or they may say the car is available for a week rental at a certain amount of miles a day. So it's really up to the owner of the car to how they want to list their car in terms of how much you want to charge for it. And the key thing is the owner of the car wants to get the car rented, and they're competing. So if you're in a market where a lot of people are renting their cars at a daily rate and the mileage is no more than 300 miles a day, you don't want to say, okay, well, you can rent mine, but their daily rate may average maybe $30 a day, and you say, well, mine is $50 a day, and you can only do 50 miles in mine. You're not going to get any rentals. You say it's competitive. So the key thing is look at your area. This is what you were saying in terms of marketing. Look in your area, see what the average rental goes for. What's the average day of the rental? And then look at, is it a vehicle that if it's your primary vehicle and you don't need it on the weekends, but you need it back during the week, it can only be rented on the weekends. Right. And you can determine how many miles you want it driven. You want to be driven 100 miles, 200 miles, 200 miles. You can put the maximum mileage. And if they go over that, then they have to pay a premium. And the good thing is, Brother Muhammad and everyone else, Turo, when you go on Turo, you put all your information into the app. Even when you put a credit card into the app, so that everything is there, and they vet everyone. So when someone rents your vehicle, that person's been vetted. Okay, so you don't have to worry about are they going to run off with your vehicle? You're going to, you can't find them. Yeah, and then of course you have your insurance. You insure, and with Turo, using that app, you have $1 million insurance policy with Turo for every rental. So it's really good. It's a really good system, and it's just going to get better as it goes on. But you in control. You in control how your vehicle is to be rented, and how long it's to be rented, and how many miles can be put on it.
That's amazing.
Yeah, it is.
Awesome. That's really amazing.
Yeah, it is.
Wow.
Yeah.
Mm-hmm. Okay, we do have one question, and then the Sister Nina, she said that she, on their YouTube audience, she said she used it for business traveling Georgia, Kansas, and Arizona for weeks at a time. So it sounds like she rents vehicles on there as opposed to the major rental companies. She just rents other individuals that have their vehicles for rent. She says it's easier to rent from Turo than the typical rental company.
Yep. That tells you something. Well, they're competing. They're competing with the rental companies, so they must have something.
Mm-hmm. With Sister Haja Lala with your question.
Yes. Assalamu alaikum. Alhamdulillah. As far as keeping renting the car with it being clean and it's full up with gas, are they supposed to return it as is?
Well, that's up to between the renter and the owner. If the owner says you have to return this with the gas at the same gas hand that it was when you rented it, then that means that's what you have to do. All right. If you don't return it like that, they may say for every gallon that is not returned like that, I'm going to charge you $5. Because if you notice that this is what the rental companies do, because they don't want to have to pay for the gas. So it's really best, but that's an agreement between the renter and the owner of the vehicle. And of course, being clean and being taken care of, because both the renter and the one who owns the car, they are reviewed. The renter writes a review of the host. I say the owner, but the person who owns the car, they're called hosts. They write a review, and then the host writes a review of the renter. And you want your reviews to be 5-star reviews and kept up there, because you want to keep your car on the Turo platform. And a renter, if their reviews go down and they abuse people's vehicles, Turo will take them off the platform. You see what I'm saying? So for both the renter and the host, you want to keep your reviews up high. You want a 5-star review on both ends.
That's right. That's right. Got to play it safe. Thank you so much. Alhamdulillah.
You're welcome. Walaikum assalam.
All right, that looks like that was the last question that we have. I see Sister Quran, your mic is open. Did you have a question or a comment for Brother Akbar?
Yes, sir.
Okay.
Yes, sir. Assalamu alaikum.
Walaikum assalam.
Yes, I just want to know, how do you control theft?
Okay. This is how you control it. Two ways. As she as a young lady who made the presentation said, one is with insurance. All right. So insurance. The other is with tracking. So you can put a tracker on your vehicle. So even if it's stolen, it can be tracked. Okay. So based on there are various tracking apps out there that will be able to track your vehicle if it is stolen. And in fact, if you have a tracker on your vehicle, usually that insurance is a little lower, because you can let them know that your vehicle has a tracker on it, so that they will lower your insurance, because if you have the tracking on it. So there's the two ways to help control it. Unfortunately, we live in a world that things happen, but you want to protect yourself as much as possible. And in this day and time, those are two ways I can tell you, Sister Quran, where you can protect yourself. And particularly when you're in business, because when you're in business and you carry your insurance, then when it comes time for you to file your taxes, you can deduct that premium, all right, because you're protecting your business, all right. And so you don't have to be afraid to insure your investment, and your vehicles is part of your business, and it's your investment. So you want to make sure it's insured. So those are two ways to deal with theft, Sister Quran.
Alhamdulillah. Well, my husband, he want to ask something. Go ahead, Shuja.
Yes.
Assalamu
alaikum.
Alhamdulillah. If I have a car, is any way that the person that rent from me, I can take their picture?
Well, this is the thing. If you're using an app like Turo has all their information, Brother Suja. They have all of their information, all right? The pictures, profiles, they have everything of that renter. Okay, that's number one. Number two, what you're gonna do taking pictures of is of your vehicle before you release it to them. And what you gotta do is you gotta upload those pictures to Turo, so you can document what your vehicle was and the type of vehicle and the condition your vehicle was. You even take a picture of the mileage, so that you can let them know what that vehicle was and the type when you release it to that printer. So when they bring it back, they take pictures of it to let them know, and they upload those pictures to Turo to let them know they return your vehicle in the same condition that you rented it to them. It's really good. It's really good. It's really a good program.
Yeah, I like that.
Yeah, it's really a good program. Yeah, it's really a good program. Alhamdulillah.
Okay. All right. I think that was the last, looks like the last question, Brother Akbar. So if you want
Okay. Yeah, I want to make some comments, just a few comments about the presentation that the Muslim Health Consortium made. I didn't want to call in at that time. I said, I'll just wait till I get on with my presentation. But I was in total agreement, and I will share with all the believers on and our visitors in terms of taking care of our loved ones. My mother passed away about a little over a year ago. She was 99 years old. And my mother, before her mind kind of got to the point where where maybe dementia started setting in. My sister encouraged her to sign documents giving her her power of attorney for her health care and for her financial situation, things like that. Take care of her business, And you know how families are. But my mother chose my younger sister to do that. Now, one of my brothers didn't like it, but that's just, that's the way it was. That's the way it is. Before when her mind was still sharp. So those final directives or whatever, those are very important, brothers and sisters, to do before your loved one gets to a point where they can't do it on their own, or someone may challenge their mental capacities for doing it. That's number one. Number two, my mother fell in her rented apartment, and she was on the floor of her apartment for a whole night. Before that next day, someone came in front of her. She was banging on the floor. So one of the neighbors came up. She was in a senior citizen building. So one of the neighbors came up and eventually called the ambulance, came and got my mother. From that point on, of course, the social worker said she could not be by herself anymore. And our family, we got into it about who's going to, where she's going to be and who's she going to be taking care of. So before she got to the point where she couldn't make decisions for herself, she had asked my sister, could she come live with her? And my sister says, of course. So my sister took care of my mother probably for the last 3 or 4 years of her life. And I know that quality of care extended, well, Allah knows even a bit more. So, but I know the quality of life that my sister gave to my mother extended her life for at least 3 to 4 years. I know it. I know it in my heart. My mother was on 4 or 5 or 6 medications. When my sister worked with her for about a year, she was only taking 1 medication, only 1. Right. So, the quality of care, the good food, the home cooked food, and just that quality, that kind of care that you're not going to get in no nursing facility. You're not going to get that in no healthcare facility. You can only get that from a loved one who loves you to the point where they know what you need. And she kept her right there till my mother passed away right in her home, in her room. Okay, that's the quality of care. Now, it does take something out of you. It does, and so we tried to give her release as much as we could, and she had people to come in and help her. But that care is second to none. That home, that personal care is second to none. And one of the things I would like to see in our own community, Brother Adele and brothers and sisters, if we cannot start anything else but at least a adult daycare that is Muslim owned and operated. If we can just start something like that to provide that kind of care for our pioneers or whatever, that's something that, inshallah, I hope we can be able to do here in Chicago. But if we can replicate that around the country, that would be a good start. Then maybe eventually a skilled nursing facility that we control, if we can get that. But a home daycare, I mean a adult daycare, that would be something that I think if we could start something like that, would be great. So those are the comments I just wanted to make, Brother Adele, before I got off.
Okay. Yes, sir. Alhamdulillah. Yes, sir.
Yeah, and I think it was about maybe a little close to 10 years ago, Brother Osman was interested in doing that. And I don't know what happened. He had maybe even began, I don't know if you remember over at the mosque, he had began to take some steps towards trying to make that happen.
Yeah.
So I know the interest, I know is needed, and the interest is still there. But I'd like to see some professional people, maybe some businessmen that maybe in the community that already have gone through the process of, procuring the right type of facilities for that, or even advising us and coaching us on it.
I agree.
I'm thinking about, yeah. So maybe if they're listening, maybe we can probably follow up on that and get some advice, and we can send a call out to the community, the Muslim community at large. You know, a lot of times if individuals that have the similar concerns reach out to other individuals with like mind, they sometimes can gain more headway than we can as the Mosque Cares. Because oh, that's the Mosque Cares. Oh, that's the Mosque Cares.
Sure.
No, but that's bigger than the Mosque Cares. That's the health and well-being of our community.
Yes.
You know, our families.
Yes. Yes, absolutely. Well, that's just some of my thoughts, and I just want to share them with the believers and the visitors on the Zoom call on YouTube here for our first Sunday program. So with that, brothers and sisters, I want to thank you again, Brother Imam, and I'm getting ready to get in the vehicle and keep heading home.
Enjoy that road. Yeah, you got a little daylight. You might make it before the. Well,
that's okay. I don't mind driving at night.
No, you good. You good.
I'm good. But thank you again for blessing me to be on here for the first Sunday.
Thank you, brother.
And my wife gives you all the greetings.
Wa alaikum assalam.
All right.
Yeah, I'm jealous, man. Tell her y'all making me jealous, man. You know what it's like out there. It's beautiful out there. Yeah.
Yes.
Assalamualaikum. Good to see you. I've been seeing you smiling on you all over YouTube. Your husband. Yeah, enjoying yourself. That's what life is about. Life is about family and then sharing good times, you know.
Yeah,
exactly. Breathing that fresh air out there. I know what y'all do.
Yes.
First chance I get, I'm going straight outside. Yeah, I might tomorrow.
All right. Assalamualaikum.
Wa alaikum assalam.
Alhamdulillah. Thanks again, Brother Akbar, for his visit technology presentation. At this time, we're going to turn it over to our president and Imam W. Muhammad II, which we will be followed by our featured presenter for the day will be Imam Al-Amin.
Yes, sir.
But right now, we're going to turn it over to our president and leader, W. Muhammad II.
Thank you, Brother Adele. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Alhamdulillah. Alhamdulillah. Alameen. Assalamu alaikum. Peace be upon you. And welcome everyone. If you've been watching the program this far, we enjoyed the Muslim Health Consortium and Quranic Arabic class or study course with Imam Ela Muhammad, and we just finished up with Brother Akbar, Abdul Rashid Akbar, and his wife, Sister Venus Muhammad. And with the business and technology. And this is the portion where I make a few short comments, and I'm really looking forward to our guest, our keynote speaker for today, Imam Fleming Al-Amin, and with his address he has prepared for us. I want to also thank everyone and to remind you all that I believe our last first Sunday, our last program was the Ramadan session, right? Yeah, so we want to extend our appreciation for those that attended the Ramadan session and helped to make it a success, that we've continued the program that we believe is really most important to keep the life's work and the tafsir of Imam Muhammad alive. As we all know, those that appreciate his religious insights and his lifelong study and work for the sake of bringing humanity closer towards the life that Allah or God wants for us throughout the history, the evolutionary process of the human soul. You know, the human being, we know ourselves to be a family, one family, all coming from the first family that Allah mentions in the Holy Quran of Adam and Adam and Eve. And I was thinking about that just the other day, the Adam and Eve. I said Adam and Eve, and Allah said he created the nefs, the human soul, and then created his mate. And so, you know, you get that question, the chicken or the egg, you know, was Adam was the human soul, the nefs, because does he refer to the nefs as Adam? He refers to the community as Adam. So we're of the community of Adam. And that's what's most important to us. And that's the community that our great leader, Imam W.D. Muhammad, he committed his life to serving. to help us, and we show our appreciation by trying to keep with the instruction or the lessons, that the value of the lessons that we learned from the insights that he derived from scripture. Imam Wathaddin Muhammad Sr., my father, who passed in the year 2008. And alhamdulillah, congratulations. There's much that I can say about the community of leadership. We have a very, very unique community. We don't have a clergy as Muslims. We have an association of leaders and imams that have qualified themselves over 40 years, maybe close to better than 40 years as capable leaders. And so 40 plus years of study and insights on the Quran. We have, we're blessed to have a really learned and insightful leadership for our community, because a true community has leaders, and that can direct them and keep the community strong and healthy. So this is my appeal to us as individuals, to not fall into the tricks and the schemes that the world has out there for us, and to not do justice by those that we choose. Like Allah mentions in the Quran, that those to respect those that you put that are in authority over you, and that because of our freedom of will, that we make a commitment, just as we join just as we are U.S. citizens, that we should respect the government officials and things in authority. That it's the Satan that calls us to encourage us to do things that would disrupt the good balance that we have in our society. And one of the main things that I see, a tendency to not respect leadership or people in authority, to challenge it. It's one thing to be free, to have your opinion, but there's another thing to disrupt and to create problems and encourage it. I see a lot of that. But these younger generations, I see the youngsters today, that we should really be proud, and also to not forget our obligation, our responsibility to lead. Everybody's a leader. Any adult, any person with some wisdom or with some life experience. So, at the same time, we should be respecting leadership, but at the same time, we should always be trying to serve our role as responsible people, and trying to guide and get and encourage youngsters to improve themselves, to improve their minds, and improve their families and their neighborhoods and their communities, and to pursue education and to pursue roles of leadership. That's the way a society works. A society doesn't work if it doesn't have good leadership and good citizens in it. And this is this is an appeal that I don't want you to take lighthearted, but it's really up to us, because you with Brother Akbar's program, you see the freedom of America and democracy that the founding fathers had envisioned, that they didn't live it. They didn't see it in its fullness as we see it today. We see it really, really coming to light. I think it's wonderful that due to the type of democracy that we have, of capitalism and the freedom of enterprise that we have, that any individual, you don't have to have really huge aspirations, but you're free to become a business person. And I always said that I believe that that the best way to become a businessman, if you want to do business, is to get your feet wet, as they say. You gotta conduct some business. And so if you own a car, now this car is not just an asset or a burden. Now this car is a tool and for you to become a full-blown business person, And I always said that that's what people always think, well, hey, I need money. The businessman say, hey, I need to feed my family, or I need to eat. I need a place to stay. I need to get out of these raggedy clothes and dress a little better, And so they always say, well, hey, I need some money. And I always tell people, well, okay, that's you acknowledging that, you're in a position where you could use more money to support yourself in a society that respects the instrument that we use for commerce, the money, whatever form of money it might be, you respect that. So I always tell people that your next thought that should enter your mind is, what do I have to offer that society, the world, or anybody to get money? And I tell people it's a simple formula, that money is a byproduct of service. If you have something that somebody else needs or something that somebody else can use, that person, you're going to find that person or persons that are willing to pay you cash money for it. So money is a byproduct of service. So we have to continue to encourage ourselves and others to be useful. And it just goes back to the simple wisdom that Imam Muhammad told us, that what Allah says in the Holy Quran, that he created us from a congealed clot of blood adhering. That's the social community that we come from. In the wombs, he created you in the wombs of your mother as a social community. So the human being is in our very DNA and our nature to be sociable. And no person can benefit fully upon their own individual creation without sharing their self with the community, with the family. Because Allah says that he said the only thing that reaches him is your consciousness, your remembrance of him, but your charity and your sacrifice and your works, that's all for you. And so if you want to be blessed and do well, you have to serve humanity. So in fact, truly, our service to God, it starts with service to your fellow man, your brothers and sisters, your community and your neighbors. That's how we serve God. It's not, I tell my children this, and I keep going back to, I tell them this because I told myself this for years. I said, Allah is not, once it dawned on me as a young man, I might've been a preteen or a teen. I said, Allah is not blessing me for the things that I do to try to make achievements to better myself or to help myself. But Allah, the true blessing comes for what I do selfless for others. And that's when you realize the true value of your own self-worth is how many people you can benefit. That's why we encourage as people of faith to marry and to start a family. And a family is the beginning of a community. And once you serve, if you can serve your family as a leader, some people say, well, hey, who's the leader? Sometimes it might not be dad, it might be mom, whoever's capable. But we know as believers, as Muslims, that the man is always the leader. And nature has not changed that too much. But you might not be intellectually superior to your wife. You might not even be physically superior to your wife. And nowadays, we all know that most of us don't have as much money as she may have. But Allah has given us something because he knew that this was going to happen, this situation. Some of us might find ourselves in these situations where we're not feeling like the man. But Allah says, you are the imam. So that's a start. That's a start. As a leader, we should go out and look for service. Don't ask your wife for car fare today. Tell her it's a sunny day. I think I'm gonna walk to work today. So we have to be leaders. We have to take the role and accept the role of leadership so that we can advance society. Inshallah. I talked longer than I wanted to, but I'm excited. I'm really excited about this next program. And I hope some of what I said, that we take it serious, that we should live our lives every day, every moment, every waking second, with the awareness and consciousness that God, Allah, the Lord and creator of everything in heaven and earth, God unseen, the one whose face we cannot see, but we know he's ever present in everywhere and in everything, and that he cares for us, he loves us, and we cannot manage the life, this very, very complicated life that he's given us, the human creation, without his help. So always think of Allah and always think of him as being nearer to you than your own heart, your own self-interest, and your own beating heart and the blood, the pulse that keeps you living. He's the one that wakes you up in the morning and takes your soul at night and keeps it until you wake up. You know, when's the last time you knew how long you slept when you went to bed at night? We don't know, because our soul was being kept and nurtured by our Lord and cherisher, and we all have to sleep. So we all should at least appreciate God for bringing us back to life every day and bringing us back so that we can do more in service to humanity and for the sole purpose of pleasing God. Thank you. Assalamu alaikum.
Alhamdulillah. Thank you, Brother Imam, for that very precise word. I know you wanted to bring our brother Imam Fleming on, and it looked like him and the other brothers got the camera when they were enjoying it like I was enjoying it. Very, very impactful, straight and to the point, inshallah. So with that being said, we're going to turn it over to our featured guest presenter for today, our good brother Imam Fleming El-Amin, also commissioner. I don't think he's serving as commissioner, but it's one of those things like you never stop calling the president, even if he's out of office. So our good brother Imam Commissioner Fleming El-Amin.
Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Alhamdulillah Rabbil Alameen. Brothers and sisters, especially Brother Imam Waratuddin Muhammad II, thank you for this opportunity. I am very humble to just be a part of this presentation. There's so much to gain from just listening to each other. And your insights, Brother Imam, are just crystal clear, to the point. And I hope the community is really taking mental notes and spiritual notes, whatever you have comments to make. I would like to start off my presentation making one clarification first. I'm Brother Fleming El-Amin, not Imam Fleming El-Amin. And for that point, I'd like to make a small dua to get this program started, inshallah. And it's a dua based on our history as a community. And some of you know I've been around since I was about 13. So it's the first dua that I learned in the community, and I think it suits us well today. So if you don't mind, I will start off with, surely I've turned myself to thee, O Allah, the sole maker of creation, and I am not a polytheist. Surely my prayer and my sacrifice, my life and my death are all for Allah, the Lord and cherisher of all the worlds. No such should I say, and this is my commandment of those who submit. O Allah, thou art the King, I am thy servant. I have been greatly unjust to myself, and I confess my faults. So please grant me protection against all my faults, and none grant protection against faults with thou. And guide me to the best of morals, but none guides to the best of morals with thou. And turn away from me the evil and indecent morals, for none can turn away from me the evil and indecent morals with thou. And O Allah, make Muhammad successful, and the followers of Muhammad successful, as thou to make Abraham and the followers of Abraham successful, for surely thou art praised and magnified. And O Allah, bless Muhammad and the followers of Muhammad, as thou to bless Abraham and the followers of Abraham, for surely thou art praised and magnified. Amen. Now we know today that's an Abrahamic prayer that goes way back. We didn't know it when we first learned it, but by the grace of Allah and the leadership of Imam Waratuddin Muhammad, may Allah always accelerate him in the closest to heaven as he can get to his creator because of the work he did for us and for humanity at large. But that prayer started us all off in the right direction. And I try to teach my kids that prayer should have a foundation where we started from before we ever got to Al-Fatiha or Ikhlas or all the other things we mastered now in the Arabic language. So thank you for allowing me to say that dua. I hope I did not offend anyone. My intent is just to bring us back home for a minute before we get started. And the subject matter for today, I'll try to make it 20 minutes and entertain questions after that point. It's simply this: civic engagement, our duty and our responsibility. I repeat, civic engagement, our duty and our responsibility. Civic engagement can take many forms. I'll reference one that I was engaged in when I lived in Chicago. When our leader first came into leadership, shortly after his father returned to Allah, he encouraged us to go register to vote. So me and a brother named, at that time, Brother Colvin, who became Brother G. Bilal, went downtown to Chicago and we registered to vote as independents. That was a long time ago. But the initiation for all of that started with our beloved leader, Imam Waratuddin Muhammad. And from that, of course, we set up committees to the masjid. We had a committee called Ways and Means. Sick and Wellness Committee. We had a Culture Committee, Education Committee. About 6 committees were formed to allow people to express their own interests in a cohesive fashion to work together, because that was a little different from what we've become accustomed to, being sort of told by the captain and lieutenants what to do. And of course, the treasurer had his job of collecting those monies, paying our charity on a regular basis. And of course, the minister at that time had his spiritual responsibilities. But the idea of a committee structure, brothers and sisters, that's the foundation of government. We were being given an opportunity to really form a government, almost ideal like the American government to a degree, because we didn't have any guys in that format. Everybody had an equal opportunity to share their opinions, make offers of, ideas they may have had, etc. And it was a wonderful opportunity to really get to know each other on a working basis on a more intimate level. And I encourage any masjid or any center, if you don't have a committee structure, consider creating a committee structure for your organizational best efforts, because people join committees because they want to be a part of it. And when people want to be there, they contribute a whole lot more in that regard. I want to give you 3 references before I get started with the meat of what I have to say. One is entitled On Islam and American Democracy. And many of you know this book, I'm sure. Imam Muhammad, Imam Ronald Shahid put it together, but the words and the wisdom of Imam Washington Muhammad. The other one that I made reference to in my notes is Follow the Leader. This was sort of self-explanatory. If you don't have these in your library, I strongly encourage you to get them in your library. I'll make reference to them as I make my short presentation. And the last one is entitled The Glorious Caliphate. Now, this book I bought when I lived in Chicago. And it gives you a pretty specific idea of what the Medina community was like during the time of Prophet Muhammad, peace be upon him, and what happened to those first 4 leaders after he returned back to Allah, and how they governed the Medina and eventually the community of Islam that spreads from Medina into other parts of the world at that time. Well, out of your 3 of us, we knew it then. But I'm going to refer to these books because they give us a good foundation on why civic engagement is our duty, our responsibility. And I start off with the most, well-known document that gave individual citizens their rights. That document, brothers and sisters, is the Medina Charter. And I encourage you, if you've never had a chance to go back and Google it up, take the time. Based on which one you're reading, there are about 47 articles, some will say 48, that are attached to that document. Some of those articles identify something we take for granted in this country from the First Amendment, and that is freedom of religion. Again, Prophet Muhammad was so wise, peace be upon him and his family, that he allowed any community, the Jews had their way of worship, he allowed them to continue that as long as they didn't do what? Break peace. Some people who were not even believers, they were allowed to continue their cultural expression as long as they didn't do what? Break the peace. It was the first example of a pluralistic society where everybody had equal access to government as long as you did not break the peace. Now, that concept evolved from that small Medina Charter eventually into Europe as a part of the Magna Carta signed in 1215 by King John by force. Because those barons got tired of giving them his wealth and they didn't have a voice in government. So he did it under duress. And eventually that led into what became known as the English Bill of Rights. And eventually when this country became to stretch its muscles and gain its own independence and write the Declaration of Independence, some of those same ideas, brothers and sisters, are written in that document. Now, our leader quite often refers to that second paragraph in the Declaration of Independence as an Islamic concept. I'll repeat what he said briefly. We hold these truths to be self-evident, that all men are created equal, endowed by their creator with certain unalienable rights. But among these rights are life, liberty, and the pursuit of happiness. That's just the first sentence. That's an Islamic concept. And I've been in discussion with many Muslims from different schools of thought who try to put down the Western idea of democracy when they don't realize how close those concepts are to Islamic principles, because they haven't taken the time to really study them. They just have a cultural bias in many cases. I again repeat, the concept of all men be created. Now, if they were wiser, they would have said all human beings. We know better now. But they were writing in the 1700s and they were not as enlightened as we are today. The idea that your gods gave you rights that no government can take away from you, That again, brothers and sisters, is an Islamic concept. And it also gives you justification for you being civically engaged. Because at birth, by the grace of Almighty God Allah, subhanahu wa ta'ala, you have a responsibility, and you have a duty to make a contribution to the government that you live in. And this government's design is parliamentary procedures, the 3 branches of government, all of that was established in the Medina Charter. So in fact, if you research it further, the idea of having a consultative body comes straight from the Holy Quran. And people took that concept, specifically people like Thomas Jefferson. He has a book out, some of you may have read it, Thomas Jefferson, His Holy Quran. In fact, you can find copies of His Holy Quran in the Library of Congress and the Jefferson's library. You can go inside and they'll take books down on a digital manner, and you can read some of his books that he had in his personal library. Those books are housed today in Washington, D.C., in the Library of Congress. And I think Congressman Ellison, Keith, he used this book to take his oath of office when he was a congressman, in fact. So there's a direct link. That's what I'm trying to give to you, brothers and sisters. A direct link between this form of government and our Quranic principles. So we should be eager, be steadfast in defending this idea of democracy as expressed in those documents. Now, we all know that they were not initially in our favor. And it took years for them to realize that we were not 1/5 of a person, that we were a whole human being. But the founding ideas are strictly Islamic concepts. And in time, by the grace of Allah, all of us got included in the Constitution. And in time, the 13th and 14th and 15th Amendments were added to the Constitution, and it expanded these rights of most citizens in this country. And eventually the 19th Amendment gave women the right to finally vote. I'm saying that to say there's a graduation in people's thinking and their development, but all that would only be possible because of the Quranic influence on how people should be governed in a true democratic society. So that's our foundation. And I will, provide some PowerPoint for those that are interested. It gives you more documentation and examples of how that evolved. I'll give you an email address eventually. If you want to contact me, I'll be honored to send you a copy of the PowerPoint. And you can really take the time to discuss this in far more detail with your peers. Now, once you get the foundation, you got to have those freedom documents as a reference point. And by all means, read carefully what Imam Warfadin Muhammad did for us in the book on Islam and American democracy, because he clearly identifies in that book our duties and responsibilities. We can't say that we born in this country, our children are born in this country, our grandchildren. In my case, Allah's blessed me with 13. I want to make sure their future in this country is solid. And I have to do that by making my impressions on the grace of Allah, my greatest influence on how these things govern for their benefit. So I have to think beyond my years and think down the line. How can I influence this government to better serve the everyday person, including my grandchildren and their children going forward? What contributions can I make? And so I got involved in the political process some time ago. I was encouraged when I lived in Chicago. I used to work at Guaranty Bank and Trust Company. My wife and I both taught at Muhammad University of Islam from 1974 to 1976. And Imam Muhammad invited me to come to the house, 47 Woodlawn, to congratulate the students who were graduating that year. Some of them included Imam Daniel Kareem's children and my brother Amir Muhammad. And I won't go through the whole list, but there were a lot of family members and children who were there. And it gave me the impetus to really consider going back to graduate school. And your father, Imam Muhammad, specifically told me, Brother Fleming, go back to school. Because I was wrestling. So I stayed in Chicago because I finished my undergraduate degree from Cornell, but I had an interest in going to graduate school. So he said, go back to school. So I left Chicago and went to Arizona to go to graduate school, and Allah blessed with some other success in New York, et cetera. But it came from the encouragement of Imam Warfadin Muhammad, and I'll always hold that dear in my heart because of that. So the concept again, brothers and sisters, civic engagement. If you really take a cursory review of the Quran, just the word civic, you'll find out that really that's a charge on us as Muslims. You can't say you believe and stay in your house all day and do nothing to help your neighbor. You have to be engaged in the concerns of your community. That's a part of civic engagement. You have to be concerned about how the quality of life in your neighborhood has been impacted by those elements that you'd like to see change in your community. That's a part of your civic engagement. You have to be concerned about the safety of children who are unfortunately been killed, in an unimaginable time period from this gun violence. We have to be concerned about that and be in the arena to make a difference, not just being a critic on the sidelines, complaining and making, I would say, sometimes only constructive criticism, but sometimes it's just criticism instead of being engaged in the process to help. That's a part of civic engagement. If you're not sure of the process itself and how it works, find someone in the community that has that interest. I used to be the chairman of the party in Forsyth County for a number of years, and my job was to organize 101 precincts. And that just meant this, brothers and sisters. I had to get 5 people in the neighborhood to come together at a certain time, organize themselves with a chairperson, vice chair, treasurer, an outreach coordinator, and that formed a precinct. And that's your nuts and bolts of any political organization, your precinct structure. And from that, of course, if you have the interest, you get people involved in the community to be a part of that precinct structure, you identify your voting area, you make sure that voting precinct, of course, is accessible, and there's no unnecessary stumbling blocks for people to go there and vote. There's no, as I say, hanky-panky going on to discourage people once they go inside to vote, and you make sure that takes place in a transparent way. But organizing on precinct level, it's another part of civic engagement. If you have that kind of interest, you get involved. Allah has blessed me to serve at one point on the Board of Elections. And so I have an idea of what's involved in that process. And we all know that quote, big lie was never anything like that, because the way the thing is structured, it's impossible to actually alter someone's vote on that kind of scale. So as that experience positioned me to be in a position to be invited to serve as a county commissioner, because one of my dear friends passed away unexpectedly, and he'd asked me to serve in his place. And so I did that, and Allah blessed me to be successful to run on my own, and I served for 4 more years. And as of December, of course, I didn't make it in the last election. I lost by 88 votes against 5 people, but I said, alhamdulillah, I learned a lot, and I thank Allah for that experience. But it gave me this kind of opportunity. I work with the governor now in North Carolina. I'll give you one small example how civic engagement is so important. When the brothers in the prison industry in North Carolina were being challenged during Eid festivities, given the kind of diet that they wanted, the American Coalition for Good Government wrote a letter to the governor. He responded immediately by getting his supervisors to make food available to those brothers. All down to just having that kind of relationship with the governor of North Carolina. Again, it's an extension of just your civic engagement in the process to make a difference. We now have in North Carolina one of the youngest senators in the state of North Carolina, Muslim. We have the first convener of the American Coalition for Good Government, Brother Nasif Majid. He represents the 99th district of Charlotte, which is in the county of Mecklenburg. Some of you may remember he used to be the pilot that we hired for the plane that we bought for the Honorable Elijah Muhammad. So he was in Chicago for a while and stayed there for quite a while too. We've been friends for almost 50 years, but he serves today as a representative in the State House in the state of North Carolina. Another example, brothers and sisters, of just what civic engagement can do for you. And finally, there are a host of different committees that you can serve on as a citizen. Let me give you an example. Every city structure has a Parks and Recreation Committee. You might say you may have a zoning and board committee. You may have a planning committee. The list goes down. Generally speaking, those committee appointments are made by your representatives for that locality, whether it's on the municipal side or the county side. It comes about based on you communicating and have a good relationship with those representatives. And that gives you your foot in the door to see how decisions are really made. And it will really make you appreciate how the committee structure works. Because committee make recommendations, and then they will vote on those recommendations. It goes to the final mayor in some cases, or county manager in some cases, and he follows the directions of the county commissioners. They set the policy, he's charged with following them up and enforcing them. On the city side, of course, those city wards are controlled by those city council persons, and they make decisions. And of course, they hand it up to the mayor. The mayor has the duty to enforce those things. But the process all begins on the committee structure. So get involved in those committees. Even your Board of Elections and your Board of Education, they all have committees that they work from from citizens who primarily volunteer to work on those. And again, it's our duty. We've been blessed by Allah to want to be Muslim. We've been blessed by Allah to want to be Muslim. We have to be Muslims in the community at large. Let them see the best human being that you can be, serving humanity. And that's how we demonstrate our appreciation, our gratitude to Allah for putting a desire on us to want to be Muslims. And I will never forget when Imam Muhammad first came into leadership. I happened to be in Chicago then. And he said, brothers and sisters, Allah has blessed us because of our sincerity. He's given you two great blessings that many people never get. You had the blessing of my father's leadership. And many of you benefited from that tremendously, changed your way of thinking, to think independently for the first time in your life. Then he blessed you with my leadership to broaden your thinking on a universal level, rooted in the foundation that he gave you. So for those of us who've had those two tremendous blessings, we have an obligation. We have a duty, brothers and sisters, to be civically engaged in our community. To be civically engaged in our community, it means simply to be involved and care about what happens in your community. And with that, brothers and sisters, I'm going to conclude and ask if there's any questions. I'll be more than happy to answer them. I just got a little note from my boss lady here. She said, you do not refer to Glorious Khalifa. Okay. It's good to have a checkmate. But this book, it gives us the 7 principles they govern the Medina Charter by. I'm going to just take a minute and reference a couple of them that everybody had access to during the time when they had this structure in Medina. And I apologize for not having it at my fingertips, but I think I found it here. The 7 basic principles of government. Here we are. And sadly, I have to take my glasses off to read, so pardon me, please. The fundamental rights are: number 1, security of life, property, honor, and privacy. Number 2, right to possess, protect against inequity and injustice. Number 3, freedom of faith and conscience. 4, protection from slandering of one's religion. 5, the right of equal treatment. 6, freedom of association. And 7, the right to insist upon goodness and to prohibit civil unrest. Now, this reminds me of why Imam Muhammad started what became known as the American Coalition for Good Government in 1997 in Charlotte, North Carolina. That was our political vehicle to impact the political process. By the grace of Allah, I currently serve as the convener or president of the American Coalition for Good Government, and we're now engaged in a national survey to provide a database of what are our concerns locally, statewide, and nationally that we design ourselves. We must speak for ourselves as well as being ourselves, and don't let other people speak for us. And you'll hear more about this survey. The copies will be available on the link. We're going to try, inshallah, to have it compiled in October. And I encourage you, once you see the link, please go to that survey and fill it out. We cannot let other people, brothers and sisters, speak for ourselves. And those of us that have been around, we know that no one can speak for us but us about us, inshallah. Again, thank you for this opportunity to present a small presentation this evening. I'm very honored to do so. And I'll entertain any questions anyone might have about civic engagement, our responsibility and our duty as citizens of this country. Thank you again. Assalamu alaikum.
Wa alaikum assalam.
Yes, sir. Thank you, Brother Fleming. We do have a hand. Those who do have questions, please raise your hand and we'll answer the questions by the order that the hands were raised. Also, those in our YouTube audience, please enter your comments in the chat and then we'll read them aloud for you, inshallah. We're going to start with our brother Imam David Ziad.
Yes, sir. Assalamu alaikum.
Speak
to you, Brother Fleming. Just so you all know, and if you don't know, I remember, if my memory serves me correct, an orange Omega.
That's right. Boy.
In the Muhammad University Islam parking lot. You know, the young boys, they always look at the different cars that the different teachers drive, you know, and there's cracks and comments. My mother drove an older Chevy, something we probably was given, you know. But anyway, I just want to reflect back that that's how far back this Brother Fleming goes with the community when I was a child. So assalamu alaikum, thank you for that inspiring and information-filled presentation.
Thank you, Brother David. I must respond to my brother there. This mother was my principal. When I worked at Muhammad University of Islam, it became Sister Claire Muhammad School. But Sister Marvel, not Sister Salima, she heard that me and my wife, and we both worked at the school. She graduated from Spelman, I come out of Cornell College, and we were devoted to go help the lamb in Chicago. But she heard that we were sleeping on a quilt at 8700 South Murrow Street, because we didn't have any money. And so she called me to the office where they said, Brother Fleming, I heard you sleep on the floor with your wife and y'all just got married. I said, that's all I can do right now. She said, look, you take this money, go buy you a bed. I'm gonna increase your salary $25 more, get you off that floor. My teacher's gonna be sitting on the floor in this cold Chicago. I will always remember that. I will always love her for that. You tell your mother, please give a greeting from my heart to her, inshallah.
Yes, sir. Well, I didn't know she increased your income, so she had a little influence, huh?
Yes, she did.
Well, all praise to Allah. I'm gonna mention that to her.
Yes.
Thank you.
Wow, that's beautiful.
Yeah.
Alhamdulillah.
All right, next.
Did you know that, David? David, did you know that story?
No, that's the first I heard of that. So, that's gonna give me something to talk to my mother about if she can.
You gotta give her a call.
If she can recall it. But she remembers Brother Fleming, but we're dealing with some of that dementia and Alzheimer's with my mother.
Oh, wow. We're going to make dua for her, inshallah.
Yes.
Yeah, but it's been for years. Eunice stays down there with her in Alabama.
Okay.
Yeah. So, this whole day, I was riding right along with all of the information,
Alhamdulillah.
from the Health Consortium. Yes, sir. Okay, good to see you.
Them greetings from us. Alhamdulillah.
I'll make sure I do that. Adil, I see you on the side.
Oh, yes, sir. Okay, up next we got Brother Elam. We see your hand. You're not raising it on the thing. I think you have issues with your computer, but go ahead. We see you raising it on the.
I just want to give Brother Fleming the greetings. Excellent presentation, and also Brother Imam Warfdi Muhammad II. Your father would be proud. We're proud. Excellent lecture that you did, Brother Fleming. Again,
thank you.
Excellent presentation. And I sent you a text in regards to that copy of your PowerPoint, so hopefully I can get that from you.
Yes, I'll be happy to.
Thank you.
Okay, up next we have I see a couple, Brother Yusuf Ibn Shah.
Alhamdulillah. You got
Brother Yusuf, if you want to mute.
Yes, assalamu alaikum. I'm going to say Imam Fleming because we're all leaders.
Yeah.
Just like Imam Warthadeem Muhammad II have said to us, we thank Allah for him and his leadership. We thank Allah for his family and for what they have assisted us in helping us understand and believe in America and the United States. As I heard in the Ramadan session held, the United States feet to the fire on freedom of religion in this country. That just lit me up. I also want to say that your dua is Quranically based, because we had a very in-depth debate here in Islamic Studies in New Haven. It's actually Surah 62, Surah 6, 1 and 62, where you have that. So it is Quranically based, that dua, Imam. So I appreciated it when you said it, and it brought back memories to me because I learned the Al-Fatiha in Muhammad University of Islam, number 7. I think I was 10 years old when I learned that, brother, and I learned the same prayer, and I still say it with the intentions of turning myself to Allah as prescribed in Surah Al-Ikhlas. So you're on point, brother. I appreciate your civic engagement. I was an alderman here in New Haven for 10 years, and I was chair of the finance committee here. So I understand your presentation. It was an excellent presentation. And I got involved based on the teachings of Imam Warthadeem Muhammad. I was kind of I kind of had a catalyst. I kind of had a little nudge because I was on the community activist end, but it was good to be on both sides. I think Allah blessed me to be on the inside so I could see some things, and I'm glad that Allah blessed me to be there. So I appreciated your presentation wholeheartedly. And I thank Allah for you. I thank Allah for you, Imam Warthuddin Muhammad II. And I'm happy to be a part of this. Thank you. Assalamu alaikum.
Thank you.
Always good to see you, brother. Alhamdulillah.
All right, up next we have Brother Salim Manan. Brother Salim.
Assalamu alaikum.
Walaikum assalam.
Yes, it was a timely presentation. I appreciate it. Assalamu alaikum to everybody. May Allah grant us forgiveness, have mercy, and guide us. I want to say I enjoyed it. I want to put in a plug for one of the tapes that he had at Mosque Cares on the Imam when he was in Detroit. I think it's companion to what you discussed today. And I know I was present when the Imam gave that talk in Detroit, and the topic of it was what Islam and American democracy have in common. That was in Detroit. In fact, it was on VHS until you released it a few years ago. I said, man, where's this tape? Where's this tape? And you released it on time. But we all need to hear that, because the Imam talks about democracy in America, what we have in common. And at the end, he talks about what the differences are. So we all should be exposed to that. And your presentation today goes exactly with what the Imam says in there. And it's important. I can't remember the name of it, Brother Muhammad, but you ought to have it posted so that people can come on the website and buy it.
Yeah, I'm familiar. I remember it being on VHS, and I believe, did we put it on a CD?
Yeah, it's on a CD.
Sure I don't think we put it on DVD.
No, just CD.
Yeah, it can be. You can go to the website, wdmpublications.com, and if you don't see it there, then let me know, and I'll find the number.
There, but we should have it. We should have that, and you put it on time.
Yeah, and there was another title, Healthy Patriotism.
Yes,
that was in Chicago, right?
I have that one. Yes.
I used that one time. I had to give it to a person that I needed to believe they needed better information about where we stand. And this was years ago, so I don't even remember it. I'm gonna go back and listen to both of those, inshallah. Yeah.
Yeah. Okay. And again, thank you so much for being present and allowing me to have my comment.
Assalamu alaikum. Walaikum assalam. Thank you very much. The reference you just made about healthy patriotism, we had New World Patriotism for a while under the leadership of Imam Warthuddin Muhammad, and we organized one here in North Carolina, in fact, during the same time, and had a huge participation to really show what real patriotism is all about. So again, the credit goes back to Imam Warthuddin Muhammad for a lot of things, not just that, but even our heritage celebrations. Juneteenth celebrations. I could go down a whole list of things because I've been involved in the community for a good little while. So I know a lot of that comes from your father's leadership. I'll stop there. I'm supposed to be responding to questions. I'm sorry. I apologize.
No, don't apologize for that.
Good information.
All right. The next question from Brother Anthony. Go ahead, Brother Anthony.
Assalamu alaikum. I know you said brother Philemon, but this is the so important that you said we step up to the responsibilities and the duties that we have if we've been given that, and then no one can teach us. Right now the politics is trying to take everything away, and you pointed out that we got to teach our own self, teach our people, especially our children and grandchildren, and that because they don't know. The point is that they're really making a secure effort, so we don't know. But I really appreciate that. I hope to hear more from you, maybe during the convention that we've got government, because we know we have a slot for that. That they get more of us old and the more young to step up. Whether you like it or not, you don't want it, but you've been given that responsibility, so we have to fulfill it. And that's why how you really your whole talk today was just really thrilling for me. Assalamu alaikum.
Walaikum assalam. Thank you very much. There's a curriculum we put together called ACE. It's Ambassadors for Civic Engagement, ACE, designed by ACGG for our youth, and it gives them a chance to come up with a resolution to a problem that they define in the communities using some Islamic principles and the foundation of some documents that Imam Wafiq Muhammad gave us to study some time ago. So hopefully we're going to expand that. We've done the class a couple of times on Zoom, and it's directed to get our youth involved. That's the purpose of it all. It's called ACE or ACE, Ambassador for Civic Engagement. And they get a certificate once they finish an 8-week course. No cost, just taking the time to study and be sincere about wanting to study. It's the only cost, investment of time, inshallah. But thank you, brother.
Wow, that's your contact again. You to get you say email or what was that? It's going to be in the chat.
Brother Clement, you mentioned the PowerPoint. If you want to voice your information or how they can get that, and I'll put it in the chat if you like.
Okay. The email address is my first name, Fleming, Fleming, the number 07 dot the letters FEA @gmail.com. I repeat, Fleming07.fea@gmail.com. And I can forward you a copy of the PowerPoint and forward you the link to the survey if you email me directly. Honored to do so.
Thank you.
So the email is in the chat.
Thank you, Brother Dale.
Yes, sir. Thank you. Okay, up next, the next question, I think I see a phone line open. Looks like Sister Zelly, you had a question or a comment for Brother Philip?
Yes, assalamu alaikum.
Walaikum assalam.
Alhamdulillah. I don't know if you know me, brother, but your name comes up, but more in my thought process because you mentioned New World Patriotism, and I work with the New World Patriotism Day from the beginning to the end in Chicago with Sister Menaima Milwaukill and many of the believers and also city persons in Chicago. My family, the Omar family. Do you know my family, brother?
I know your voice. I gotta put a face together. It's been a few minutes, you know. I apologize for my absence of mind, but I did remember your voice very clearly.
Oh, assalamu alaikum, Sister Zelly. I'm gonna help him remember. I'm on the now, the juice.
Oh my God. Yes, yes.
I was just somewhere with some in some place picking up dinner. I told a woman, I said, you know the Doc Berry, you ever had the Doc? Yeah, I was in Doc Berry juice. I said, that's watermelon. That was the flavor for the Doc Berry juice, the shake, pardon me, the shake. Yeah, watermelon. And yeah, alhamdulillah.
Allah. It's crystal clear now. Yes. Crystal clear.
Yeah, that was what my late husband put together and family, but also I'm a sister who worked in the community with the New World Patriotism Day. The parades, are you familiar with the parades we had in Chicago, brother? I know you know them,
yes.
right?
Yes, ma'am.
I was one of the workers, but I just want to applaud what you're doing and mentioning the fact I have moved from Chicago to Stone Mountain, Georgia, but my biggest concern is that we establish more committees in our community, especially in the masjids, so the believers will be more involved, especially after coming out of the pandemic. I don't think we realize how this pandemic really sort of set us back a little, but I know Allah is the best to give us everything that we need. But I'm saying that to say to get back involved in the community so we can make sense, especially what's going on in the community now. And I often reference good government because I remember when Imam Muhammad put that committee together, and it's so important for us as believers. But I'm just so thankful to Allah I had the opportunity to speak to you, brother. It's always good to speak to persons within our, in our past and persons who want to make sense of what's going on now, and then with our children. I have managed, I think most of my children have gone to college and have degrees, et cetera, but I think most of them are focusing on business. If we want to mention that somewhat to us, but I think they already, know what they want to do and they're contributing in their best manner. But I'm saying it to say, with the help of Allah, I do want to see our masjids become more established and support mosque cares, of course, and realize the initiatives Imam Muhammad gave us because we need them. We need one another, and we sort of splinter right now. And with the help of Allah and all you good people, I feel that we're going to make it happen. So that's my concern. And if you want to share anything with me, I would appreciate it. Thank you, my brother. Assalamu alaikum. And my name is Sister Zelly. I'm thankful. Remember my voice. That's a blessing.
Yeah, and you brought some memories back when you mentioned Sister Munaima. And was her husband Brother Chavis? I'm not.
Yes.
Yeah,
Yes,
Brother
sir.
Travis. Yeah.
Yes.
Yeah.
He was
Yeah.
over the committee. He was
Yeah.
over the sick.
He was over
We
the
had-
sick committee.
Sick committee.
And a lot of people don't know this about me, but I used to ride with him every day to just shotgun. I was a child. I couldn't drive to visit the sick. And I did it every day, like for a summer. Yeah. Yeah. I got to know him, or at least I got to know his work more than him. But yeah, I miss both of them. I remember when his wife got sick. Yeah.
Yeah.
Yes, sir. Alhamdulillah. That's special. Alhamdulillah. Thank you for sharing. And I want to mention, last but not least, I want to get your phone number because, praise be to Allah, I have an interest in the thought process and our intelligence and us. As we know, we've gone through so much as a people. I asked Imam Muhammad, referencing a lecture he had given us in Indianapolis, and it referenced the mind. And he said on a T-shirt, he asked me to use his face with his hand pointing to his, the temple, so to speak, and the theme is lift up your mind. So I have a shirt that I want to introduce to you, my brother. I think most of the people on the lifeline, I can't say because I don't know everyone's on the line, but many of them do have it. And so you can purchase it and keep that thought process going. It says lift up your mind on the front and the back. And it's white with a green writing. So I'd like your phone number so I can call you, brother, and give you an order, or also just send you a picture so you can see what it looks like. But it's very, very special for us, and it was given to me over 30 years ago. And I do it more in a custom way. I don't just do a mass amount of shirts at a time. I take orders and then I send them to you, and you pay for them that way. It's just mainly to us to keep focusing on our intellect and how we should think, and keep Allah in our minds and our spirits. So that's one of the things I'm happy to share with you at this time.
Alhamdulillah. I had one a long time ago, so I've been expanded a little bit by the grace of mercy of Allah. So I need a bigger size now. But I'd be more than happy to order a few for ACGG. And my number, I'm open spirit. It's 336 575 0895. I repeat, 336-575-0895. Now, after 10 o'clock at night, I'm not available. My wife says, don't answer the phone. So I'm not.
No, sir.
People
Doing that. I have
hold on. Call you all the time. By all means, call me. Don't hesitate. 336-575-0895.
What was the four last numbers, brother?
0895.
Okay, thank you.
Thank you.
That's a sweatshirt I have now. I have both. You must have evidently you have the T-shirt, and now if you have that, that has been many years ago.
Yes.
I don't remember you, but it's a blessing. Thank you so much for sharing, brother. Alhamdulillah. And I tell my children. Do you remember Alan Omar? He's my oldest son.
Yes.
That's my son.
Yeah, give out the greetings for us.
Please.
I will. Thank you.
Thank you.
Okay, are there any
Thank
more?
you. Brother.
Salam. Thank you.
Alhamdulillah.
Are there any more questions or comments for Brother Fleming El-Amin? And the YouTube side, they're just thanking you, Brother Imam W.D. Muhammad II and Brother Fleming El-Amin for your excellent presentations. One participant said they're enjoying all the way from Chandler, Arizona. They're enjoying the program, so they just thank you both for the excellent presentations. Brother Fleming, so it's a lot of imams usually that participate. So if they were interested in maybe starting a political committee or becoming a part of the ACGC in their community, or they wanted to get their young people involved in ACE, is that something that you do? Like, do you instruct the imams on how to start it in their community? And if so, what information do they need to do that?
Yes, sir, Brother Muhammad. The best way to start, go to the website of ACGG. That website is www.AmericanCoalitionForGoodGovernment.org. I'll repeat it, www.AmericanCoalitionForGoodGovernment, it all runs together, .org. That website has, of course, the mission, get started, There's a platform, there's an agenda, there are articles that have been written, and you can always put in questions on that website as well, and we'll respond back to them. That's the first initial starting point. And if you care to become a part of it and establish a chapter, there's a way to do that also on that website. And we really what we're trying to do now, we want every community to have an outreach person that they identify that has the interest. Now, everybody doesn't have the interest, but at least have one person that you identify to come to our meetings. We meet every Sunday, 8:30 a.m. Eastern Standard Time on a pre-conference call to discuss recent events taking place in the community that may impact us politically. So go to the website initially, look over, what's available there. There's a handbook, there's a space to ask questions, and quite naturally, there's a small contribution if you'd like to share some resources you might have to continue the mission of ACGG. But you don't have to go to the website for that purpose. Just go there, ask a question. I'll send you the curriculum for the ACE program if you simply put that in a question box on the website. Be happy to do it. No charge. And we want to get this expanded as much as possible. By the grace of Allah, I attend a lot of other groups, and I won't name them by name, but everybody wants to speak for us. It burns me up sometimes. And I had to go into my FOI mode one time with a brother. I was raised that way, so you're not going to say anything about my community without facts. I'm afraid I was not reared that way,
Yeah. Yes, sir. And then just one more time, if you don't mind, give me that website so I can enter it in the chat for our YouTube.
Yes, sir. Okay, www.AmericanCoalitionForGoodGovernment.org.
Okay, .org. Yes, sir. Got it. Okay, thank you for that. All right. Are there any more questions or comments for our brother Fleming?
Assalamualaikum.
Walaikum assalam.
Alhamdulillah, Brother Fleming. This is Brother Shuja. I'm a brother that was raised up in Chicago, and I just listening to you and how you approached us. You humble yourself and say that I'm not a imam. I'd rather be your brother. And that's right there just remind me of Chicago. If a person comes out of Chicago, there ain't no big eyes and little you. All of us is in there together. And the imam brought that type of freedom to us and equality. And I will always humble myself to be up under the type of brother like you for any type of government, because I know that you got love in your heart for our brothers and sisters, and you're gonna stand up for the truth. I heard you say that your FOI strength comes out sometimes, so I know you'll stand up for the truth. So I'm thankful, brother, and I just, my wife and I, we just listened to everything that you said. And I was telling her, I said, now that's the type of brother that I was raised up under, So I'm thankful to hear your talk, and we pray that Allah continue blessing you. And I just want to say, assalamu alaikum.
Walaikum assalam. Thank you so much. Thank you.
And Brother Sujai.
Yes, sir.
People out here, there's a lot of people out here know you and love you, and I feel especially blessed today. I'm listening to at least to three of some of I consider the heavy hitters when Imam Muhammad came in almost by himself with not really too much help and support, but he had a group of young brothers and sisters. Sujai is one of them. Y'all just heard Sister Zelly Omar. She's one of them. And you see Brother Fleming. You see him here. These people, I mean, you all were what established, you all were during the Prophet's time, what would you consider the type of service that, because Imam Muhammad, he brought in a whole new concept and idea, but it required special people to carry that message and to establish what the new message was. And you all are we're bear witness, and you all should take note. The audience out there should take note of these people that you hear on here, that these are people that are still working, and that in the early days of Imam's leadership, when he was establishing the Quran and the son of the Prophet Muhammad, the new direction for us. These brothers stepped out of the mind of the Nation of Islam and smoothly transitioned into the leadership and followed the teachings and the leaders of Imam Muhammad. And you witnessing some of the most successful people. Allah has not left them. Allah is still with them and has blessed them. The young people need to get to know these people. These are the heroes, not the people you see on television, read about in the newspaper. But as far as our community and the direction that led us to where we are and that helped Imam Muhammad get to where he needed to go until we got where we needed to be. These are humble, very humble, like Sujai mentioned, that we know is Imam Fleming's, his humility and his selfless. That's just who he is. That's his personal makeup. And he knows but he ain't gonna tell us. He ain't gonna say change my title, but because he follows Prophet Muhammad. Prophet Muhammad, the best title you can give me, here's the message, Allah's message, saying the best thing you can call me is brother. And so he's also a wise, he's an educated man. But y'all, we listening to some superstars. I'm gonna shut up, but these are people that helped establish the message and the mission, help see the mission go through, and are continuing to do the dawah. And I wanted to thank you, Sujai, because I still benefit from the dawah work you do, and I share those dawah materials that you give me with people that I see appropriate and that needed the most. Alhamdulillah.
Alhamdulillah.
Wife, the greetings, and the family, everybody.
Alhamdulillah.
Yeah, because if we don't preserve our history, it'll go to the wayside. And people should. I hope we have studious young people out there that study in our community and want to know what direction our leadership, where they began and where they ended. Because I would have never known, Brother Fleming, that that you were in the situation of poverty. He always looked like, alhamdulillah. But it doesn't matter what situation we find ourselves in. If Allah is there with us, then that's the most important thing, is to have Allah. Without Allah, you don't have nothing. So alhamdulillah. Yeah. All right.
Alhamdulillah. Okay. It looks like that was there any more questions or comments for Brother Fleming? If not, we'll allow him to make his closing remarks, and then we'll move on to close out the program. Any more questions or comments for Brother Fleming? All right, that looks like that's it, Brother Fleming. So we'll turn it back over to you if you had any final words to close out the program, and then we'll have closing remarks for the first Sunday program from our Imam W.D. Muhammad II.
Alhamdulillah. I just want to thank the ministry. Thank you, Brother Imam W.D. Muhammad II, and your staff for this invitation. I do want to close with this. I was honored to be interviewed 4847 Woodline by the Honorable Elijah Muhammad when I came to Chicago in 1974. Through Sister Marva, she took me to his house to be interviewed, me and my wife both, before we go teach at the school. And I'll never forget, she said, "Dear Holy Apostle, can we observe them for a week before we make a decision?" And his response was, "Sister, you don't make people this important work for nothing." Oh. It was an eye-opener for me, because we had a different mindset then, of course, And then leaving Chicago in '76, your father really gave me some encouragement and my students that year to pursue our serious study. And I thank Allah for having an opportunity to meet two giants among men and to be under your leadership today, Imam W.D. Muhammad II. I mean.
Yeah, and your character and your life achievements, you help validate and you help dispel some of the falsehoods and the attempts to try to misdirect try to rewrite our history for the future, because people that met the Honorable Elijah Muhammad and that sincerely loved him and appreciated him, you see the difference in those people. And you can see the sincerity and the goodness in them. The Honorable Elijah Muhammad and most of the people that were close to him, they were good people. They were good people. And the same thing with Imam, not arrogant, down to earth, humble. And that's what most people that came into the community, even after the Honorable Elijah Muhammad and under my father's leadership, they said these are some of the most well-adjusted, down-to-earth human beings, just good people. And that's what I think our community should be known for, is that we don't just say it on our lips. We believe it, and we're witness. We bear witness to the fact that Allah brought our humanity back, and in the way that He intended it for it to be, and back to the original nature. And that's what Honorable Elijah Muhammad preached. That we were the original nature, and upon the fitra. That's what we came in. As a new people, and it's a miraculous thing if you study the history. And I encourage all of us to study the history of this community in association of the one that inherited, who actually is bigger, because if the father built the work and established the work that he did and all that he achieved, all that the Honorable Elijah Muhammad achieved, and all that the Nation of Islam achieved, whether you're looking at Farrakhan, Minister Louis Farrakhan, Malcolm X, or any of the other leaders that may have associated with themselves with that time, or were part of the building of the Nation of Islam, it was all done to establish the community that we have here today. Yes, and it couldn't be done, and it could not have been established. And I believe God is still establishing it upon the leadership and the direction that Imam Muhammad was blessed with through his insights and his experience. Alhamdulillah. Yeah, so alhamdulillah. I just hope you all have been as inspired as much as I've been inspired to study and to learn from these brothers and from people that have lived a life of believers and as Muslims in this community, and on the right and established upon the proper foundation, you see. And that's the foundation that we should try to get to know and grow upon, inshallah. Thank you.
All right, thank you. So I guess we'll close it there. We'll turn it over to our Imam Elam to close us out with dua. Please stay tuned. Please donate to the Mosque Cares. The link is in the chat. You can also donate at themosquecares.com. Please continue to support the great works of our leader, Imam W.D. Muhammad.
Our planning committees for the convention are in gear. Yes. And that information you can also get. We'll be sending you emails out. And don't forget, if you haven't already downloaded the Mosque Cares app, the app will put you closer to us, so that when the meetings to start, or what the next program is. And we look forward to seeing you at the next first Sunday also.
June 4th.
June 4th. Inshallah.
Assalamu alaikum.
Yes, ma'am.
I just want to give the greetings to everyone, and to Sister Najma. Just want to give the greetings to you all and remind everyone about Mosque Cares newsletter, the Dean Soup newsletter that put together by myself and Sister Tahira. And also a special announcement from Sister Tahira today. She got married. She's in Senegal. She got married today, and she wanted to give everyone the greetings and pray for her success in her new marriage, inshallah. Thank you so much. Assalamu alaikum.
Ameen, and congratulations. Alhamdulillah.
All right. So June 4th, next first Sunday, and we'll turn over to Imam Elam, inshallah, to close us out with dua. Thank you all for joining us. Imam Elam.
Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Ar-Rahmanir-Rahim. Maliki Yawmiddin. Iyaka na'budu wa iyaka nasta'in. اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين. السلام عليكم.
وعليكم السلام.
Yes, ma'am.
Salam.
Walaikum assalam.
Assalamu alaikum, everyone. Alhamdulillah.
everyone.
Assalamualaikum, everyone.
Assalamu alaikum, everyone.
Alaikum salam. Alhamdulillah. Alaikum salam.
May Allah bless you. A beautiful, happy life. Alhamdulillah. Sister Tahira, Sister Najma. Beautiful.
Alhamdulillah, inshallah. Assalamu alaikum, everyone.
Alaikum salam.
Salam.
Oh, Akbar.